Hello. We had over 200 questions tonight. We have, so far, we have about 150 attendees, and I'm sure more will join in. When I had severe chemical sensitivities and allergies, etc., my greatest burden, one of my greatest burdens, I should say, was that I felt very alone. And I erroneously believed that my illness was I was the only one with this illness, and my symptoms were unique only to me, because I didn't know anyone else with chemical sensitivities. My family members, my friends, were not suffering from these kinds of things. Only I was. So I assumed that meant no one did, but it was not. Simply wasn't true. So tonight we're going to do our class on, excuse me, good gut, bad gut, a homeopathic strategy to uproot seemingly unrelated illnesses in body and mind. And we have lots of questions to go through, so remember this information is educational only, and it should not be used in place of a consultation with a medical professional. So you and me. It's just a reminder. I say this as a reminder to all who take my courses. I am not a physician. I'm not prescribing, advising, nor making health decisions for you. Instead, I'm informing you of the specialized information that I am thrilled to pass on to you. So the relationship between you and me is not one of a patient and prescriber, excuse me, but as client and educator. So it is fully your choice whether or not to use this information. So I also want to remind you that piracy is a crime. Please note that when you purchase this course, it is copyright infringement to duplicate any content of the course, including sharing username and password, which will result in termination of your account. Alrighty, so let's get to clearing up the confusion. All right, so the first question that Laura put in here is pathology objective, subjective, cultural, or all of these? And it's an interesting question. I imagine there's some cultural aspect to it, but to be honest, not very much. When I see GERD in the US, it's the same as it was when I was working in India for those years. When I see the diagnosis of eczema, it's eczema. So the pathology, if we're using a conventional diagnosis, and remember that is what we're looking for, a conventional diagnosis, not a theory, not a reason, not a, oh, it must be. No, it is what it is. So as long as it's conventional, pretty much it's across the board. So the next question is, might it be beneficial or possible to begin by treating the gut alone to make it right homeopathically, to make sure it is functioning as it should? Is there a protocol for clearing the gut and then treating ongoing issues that prevail after that? Or is that too hypothetical? No, we can treat the gut alone. Certainly, if I'm understanding this correctly, when we're clearing, first we start by clearing by using, of course, Camphor 200 for anyone over a year old, and not for an illness over a year old, for a person who's a year old. So that helps to clear the slate to a certain degree. So whether it's a clearing of the gut or it's treating it, or it's clearing of previous medications, what we're looking at is what is prevailing. Whatever prevails, whatever is stopping this person from living their life, that's what we're going to work on first. All right. Laura, I don't know, do you want to ask the questions and I can answer them? Otherwise, I'm going to lose my voice by the end of this class.
Let's try it that way.
Yeah, go ahead. Why don't you ask the next one?
Okay, about the Sjogren's?
Yes, right.
I'm told that the way to beat autoimmune disease, and they give the particular example of Sjogren's, is by diet and supplements. Untreated, such a disease would lead to others. Remedies that treat symptoms but without addressing dysbiosis, wouldn't symptoms of other diseases continue to appear? So I think what they're asking here is that I think they have a fundamental misunderstanding about what it means when homeopathy treats symptoms, Joette. So
I
this
agree
is worth talking
I
about
agree,
a little
yes.
bit.
Yeah, because we don't treat symptoms. We never, ever treat symptoms. What we do
So,
is we treat the condition, we treat the person with the condition and use the symptoms, because symptoms are leads into which homeopathic medicine should be used. So the question, I'm told the way to beat autoimmune disease is by diet and supplements, was given to this person, I can guarantee, either by a book, a website, or directly by someone who uses diet and supplements. We don't use diet and supplements. We use homeopathy. So it is not left untreated if we're using homeopathy. I think that clarifies it. Do you agree?
I think also she's asking if the fundamental cause of a disease is dysbiosis, and you're not treating the dysbiosis, then won't all kinds of other autoimmune conditions still keep appearing?
Well,
so say you're using a protocol for Sjogren's and you have success treating the Sjogren's, but you're not addressing the underlying dysbiosis at the same time.
Yeah, I think you're right. I think that is the question. Yeah, that's thank you for making succinct. If someone has Sjogren's and we're using the homeopathic medicines for that condition, that will correct or help correct that particular condition. How do we know that it's from gut dysbiosis? That's theoretical. We don't know that for sure. If it is indeed, and often it is, but we don't know that for sure, what we're looking for is, how do we get to the bottom of the gut condition if there is something there? And then we utilize the homeopathic medicines for that as well. But if there's no gut condition presenting, in other words, they don't notice that every time their eyes get super dry, their mouth gets super dry, it's always after having had gluten for a couple of days. If that doesn't present, then we don't really have a gut condition to look at, or we don't have a specific set of symptoms. Or if in conjunction with the Sjogren's that we also have, we have constipation. If there's constipation, then indeed we will treat the gut condition, and it will probably affect the Sjogren's. But if none of these are related to the gut, then how can we make the assumption that it is gut dysbiosis? So in other words, we do go after the gut dysbiosis, but I want some symptoms for it in order to determine which remedies to choose. I think that will become evident as we move along tonight.
Yep, let's go to the next slide.
All righty.
All right, so the first question regarding where do I start is, I'm a post-menopause woman with hypothyroidism. I've had a lumpectomy, radiation for estrogen-based breast cancer, I'm assuming, and irritable bowel syndrome for years. Where do I start?
Well, post-menopause is valuable to know so that we know approximately her age, but that certainly is not a condition. The next statement, or the next name of a condition, is hypothyroidism. And if she has hypothyroidism, that needs to be treated. That needs to be gone after. But not if it's very mild, or if she's stable because of, say, botanical-based products. But it sounds to me as though the irritable bowel syndrome is really where we start here. Also with hypothyroidism as a secondary. So irritable bowel syndrome can be, and often is, quite profound and affects people's lives pretty deeply. So of course we start there. We certainly don't start with postmenopause. We don't start with a lumpectomy radiation because that is not a condition. We no longer have that condition for which she was being treated with surgery and radiation. So we start with irritable bowel syndrome.
Something that you talked about quite a bit in the last few courses that you taught, Joette, was about prioritizing the symptoms or ailments or problems that have the greatest negative effect on your life currently.
Yes.
You know, that has the greatest negative impact.
Yes, yes. So irritable bowel syndrome is pretty negative. I mean, that can keep someone tethered to the bathroom. So we want to go after that. And then we also use hypothyroidism as a secondary condition that we would go after as well, most likely.
Yep. So say you have irritable bowel syndrome and cancer and a ingrown toenail. You could probably leave the ingrown toenail until you've dealt with the
Yes,
more
you're
serious
right.
condition.
You're right. Absolutely. You go for the biggest and the best first.
All right. So unless, of course, you can't sleep at night because the toenail is causing such pain, then maybe you want to do that as an
If
acute
it's
first.
extreme enough or someone's going into sepsis or something like that, then absolutely we're going to consider that as well as part of the schedule.
All right. As a child, I did some dumb things. I inhaled smoke from cap guns because it was cool. I
Oh,
played
I
with
did that
mercury
too.
from old. Yeah, it smelled great. Played with mercury from old wall thermometers, rubbing it on money to make it shiny. Who knew it was a hazmat? I had a mouthful of metal fillings, bad dentist, vaccines too. So should I look up some remedies to fix myself from what I may or may not have damaged from my past? What should I do?
Okay, well, I was in kindergarten in 1957, and we played with mercury in our kindergarten class. And I also sniffed cap guns, and I also had vaccines. And I will bet anyone who's in their 60s has done all of these. If there's no pathology, specifically, there's the key word, specifically related to those conditions, we just let it go. Your body's apparently taking care of it, especially if you're my age. By the time you're 66, if none of these things have gotten you, you're pretty, you've gotten past it most likely.
What things can block the path to healing with homeopathy? Specifically, I'm wondering if chiropractic needs, jaw, mouth, structural issues, and cavitations can hinder healing with homeopathy. Might a person need other therapies first, or might they need to treat hidden ailments first, even if they don't feel bothered by them?
I don't believe that chiropractic. Let's see, blocking. Let me back up. Chiropractic can be useful if someone has a cavitation, which is a osteomyelitis, a deep bone infection, and that tooth remains there. By all means, you need to have that tooth extracted. Can that hinder homeopathy? No, it wouldn't hinder it, but it certainly would not give you optimal health to try to go after something where a tooth is blocking and keeping an infection at bay. So anything else, I would not worry about going after hidden conditions, but I would go after something like a cavitation and get rid of that, in addition to using homeopathy. And in fact, homeopathy can treat cavitations. But if the tooth remains, the tooth must be removed by a good biological dentist.
If a person is sensitive and struggles to remember to take multiple remedies per day, is it okay to start with just one protocol at a time, or is it truly best to layer multiple protocols at the same time?
No, you can certainly start with one protocol at a time, absolutely. Most people are in a hurry, however, so they like to get a lot done at once. So you decide, choose the remedy that's going to make the greatest impact, or choose the protocol that's going to make the greatest impact, and that's usually on the most trying condition.
How do you prioritize what to work with when someone has food and environmental allergies, lower body issues of severe knee pain, joints locking, loose ligaments, and increasing disability with muscle cramping or refusing to function, causing difficulty walking? It shifts in intensity. There is also bladder incontinence and numbness in legs, feet when sitting too long.
Okay, so we have to look at if the person has food intolerances. Is it to most foods and they're now left with only bone broth and some vegetables? You bet we have to go after that if it's that extreme. If instead what the person is saying is that they can't have gluten and dairy, I would leave that aside for a while. Environmental allergies, it depends on what the person means by that. How extreme is it? So we're looking for the most extreme conditions. If the environmental allergies are to the point where the person can't leave the house without a mask and suffers horribly, can't breathe, has asthma, their nose is all swollen, they get bloody noses, they have fainting spells because of environmental allergies, that is a priority. If instead what they're saying by environmental allergies is that every fall they have sneezing fits for 2 weeks, I would not consider that the most important condition. Now, as we go through all of these, muscle cramps, how severe are they? So we're looking for these conditions that are the most um, most intense, the most severe conditions, those conditions that are keeping the person from moving forward. We start with those. We can use 2 or 3 or 4 of them, but we start with them. So it seems as though these questions are sort of asking the same question in slightly different ways.
How long should you plan to take remedies like Bovista and Athusa for food sensitivities? What if it's not very much better after a couple of years?
You take remedies for as long as they are doing good and you're moving along. Now, what if it's not very much better? Meaning not better at all or not very much better. So we have to remember what that means. This photograph, this image of this little boy and the clock is really important because unfortunately, we live in a world where people have expectations in which things move very quickly. Bam, bam, bam. You've got something wrong you've got a fever, you take that Tylenol and bam, it's gone. Or you've got asthma, you take that steroid inhaler and that asthma is aborted right then and there. So we've grown accustomed to believing that the answer to illness is through medicines that will move along very quickly. If you've had allergies for 40 years, as I did when I first started, actually it was about 30 years, I can't expect that it's going to move along super fast. It just happened to move. A good percentage of it moved along rather quickly for me from my first homeopathic medicine. But what we're looking for is less intensity to the symptoms lasting for a shorter period of time and a larger space between each episode. If, however, this question is really saying, I'm not getting any better, make sure you are you're comparing. You want to overlay your information from a year ago to the way you are now, because a lot of times people forget how sick they were. But if indeed there's not much change at all, it's time to come up with different medicines. Do you think that answers it, Laura? Do you think that's a good answer?
I do.
Okay.
This question follows along from the previous one. Is it possible there will never be full improvement? If so, how do you know when to stop taking remedies?
Oh, you mean like you want perfection? What do you mean by full improvement? Listen, when I'm speaking, and I mentioned this earlier, my voice gets hoarse sometimes, and especially when I'm around, allergens. Now we've just been renovating our home, and there's a lot of dust all around. And although I vacuum every day, there's still dust, and my voice gets a little hoarse sometimes. I would call that an allergy. Sometimes my eyes water a little bit. I would call that an allergy. But the allergies that I had decades ago compared to the allergies I have today is like night and day. So if someone were to ask me, do you have allergies? I'd say, well, maybe a little bit. So I'm not perfect, and I don't expect it to be perfect, but compared to the way I was, holy cow, big difference. So
I think when you're really sick, you really focus on, the goal of a complete cure. But then when you're, 90% cured, it doesn't become so important anymore, I think. Like for me, I used to have terrible eczema, and it was really debilitating and causing all kinds of problems in my life. I still have eczema, but it's the point where I only get like a little bit of itchiness and dry skin on my hands now if I wash dishes a lot without using gloves or something like that, or do a lot of cleaning where there's something really dusty.
Yeah.
And I don't even think about it for the most part,
What you have to do is think about when you're experiencing symptoms now after having taken the medicines for some time. If the condition you've got now were to come out of the blue and you never had a history previously of the severity of the illness that you've experienced, you would not be comparing it to the way you were. You would say, oh, look at this, a little eczema on my fingers. Not saying, oh my gosh, this must mean that my whole body's going to be covered from head to toe again. Or when my eyes water and my throat gets a little hoarse, oh no, here comes the asthma again, and the sinus pain, and the headaches, etc. You have to go with what you've got now, not looking back and saying, I wonder if it's ever going to come back again. Just live your life. Nothing will ever be perfect, but we can get you so far in homeopathy. If we can bring it 80% improved, would you be happy with that? I would be. I would have been if someone had said that to me. I always wanted 100% until I recognized that there is no 100%. There's no such thing as complete cure. So,
yeah, and I think also my point was kind of, like once you're, at the 80%, 90% point, you get busy thinking about other things.
Right.
And yeah, you don't even really care anymore.
Yeah, now you're worried about the bus that just hit you.
Yeah.
And when you stop taking the medicines, when you see that you have come to a plateau and it's no longer, there's no point in going any further, then you back off. If you find out, you back off, and then you notice that it's coming back again, it's time to reinstate for a while again.
In class 4, you said wait and see if it works for several weeks before changing, for example, Ignatia to Ora Metallicum. Can you be more specific on several weeks? In class 2, you said wait 13 weeks of protocol for anything chronic.
Well, it's between an 8 and 13. And so that's why I do that. I try to make it so that you can see that it's not an absolute 8 weeks or 13 weeks or whatever. What I'm trying to get across here is that you want to wait until you see some improvement, at least 2 months. And what I do when I work with clients one-on-one, we schedule appointments about 8 weeks, because oftentimes we see a change right around 5 or 6 weeks. And that gives us a couple of weeks of information. So, yeah, chronic can be you wait for 2 months. If you still don't see a change and you still feel pretty confident that these are the correct medicines, keep going, go for 13 weeks and then assess.
Okay, can one stay on remedies indefinitely, or is it important to stop taking them for a while to give the body a break?
No, you would never take a medicine indefinitely. You take it until you're done. I guess that's the best way to put it. And what does done mean? It means you've gotten to a certain point and can't get any further, and now it's time, and you're still quite ill or somewhat ill, then it's time to go to the second protocol or reassess and look at it slightly differently. Perhaps your diagnosis has changed. So no, you don't, and you don't need to take a break necessarily.
So it kind of reminds me of the way athletes view certain exercises. They'll do an exercise routine or whatever as long as they keep making gains, but once they hit a plateau, then they switch it up.
Yeah, I guess
So,
it could be something like that. Yep.
So part of what you mean by done is that either you don't need the remedy anymore because you're very much better, or you have hit a plateau where you're not seeing improvement anymore, right?
Right. It's like remember folks, think of this as medicine, because that's what it is. These are not supplements, they're not vitamins, they're not nutrients, they're not essential oils, they're not botanicals, these are medicines. And so you use a medicine until the medicine is no longer needed, or we find out that it's not correct, or we find out that it needs to move on. It's just like regular medicine in that regard.
Okay, how do we determine which potency to use amongst 200C, 300C, 6C, or 6X, when we see several different ways of doing it?
Well, let me ask you, Laura, didn't it's been so long since we put this together, this course, long ago. As I recall, we gave exactly the potencies that are to be used for the protocols. I don't believe I left. Go ahead.
Some examples, there's multiple options. For example, Bovista is one that's used differently in some cases than it is in the protocol. But we have more questions like this. So let's skip this one and go use the ones that are more specific, because that'll give better examples.
Okay.
All right. Do you use LM potencies, Joette?
No, I do not. I find them too complicated for people to use, and I don't see that they make any difference. I have used them, but I found it too complicated to explain to people how to do it, difficult to find the pharmacies that are willing to sell it, and expensive for my clients and students to use, and I never saw that it made that much difference, or any difference for that matter.
This person wrote, I am only able to get 30C as the lowest dose for the homeopathic remedies from my supplier here in Australia. Can I substitute 30C for 3X and 6X potencies?
Well, you can do what what you like, but to be honest, if you're expecting the kind of results that we are accustomed to seeing by using these exact potencies, then it may fall short. However, OHM delivers all over the world, so use your OHM connection and get your discount there because you're a student.
If Ignatia 200 makes me feel numb, is it okay to use Ignatia 30 or Ignatia 6C?
I find that Ignatia 200 is the one. Does it mean that you can never use 30 or 6? But doesn't mean that you never would, but 200 is really the potency. And if it makes someone feel numb, if we're talking about horribly numb, and this is, I can't take it, this is wrong, and you're not getting any benefit from the Ignatia in helping with anxiety, etc., then it's the wrong medicine. You need to move on. If it's just a little bit of numbness, and you can get past it, and you're getting benefit from having used Ignatia 200, I would just ignore it and move on.
What do you suggest that people do if sniffing a remedy out of the bottle is still too strong for them? Is diluting the remedy in lots of water and then sniffing it okay?
Yes, someone could do that. But I find that more often than not, if someone is, if a remedy is too strong for them, it's often the wrong remedy. So think of that first. I'm not saying it's not possible that someone could be that sensitive, but often if the results are negative, it's because it's ill-chosen.
Let's see, somebody is just sharing in the chat window that Brower in Adelaide, Australia has low potencies, and the student was just able to order a 3X from them. And Similimum, New Zealand, also has low potencies and will send them to Australia.
And also Helios in England will send to Australia.
Yep. Okay, so
thank you for that information, folks.
Yep. How do I know when to stop a protocol if I'm not sure what symptoms are related to thyroid? In my case, I'm hyper, and glucose, which is high. What symptoms are related to those issues? Annual testing shows both are abnormal, but I don't know what symptoms to look for, so I don't have a way to gauge improvement until the next year's test.
If there is hyperthyroidism and there are no symptoms, and if there's high glucose and there are no symptoms, first of all, I'd be surprised. You might want to look a little bit more closely. It's likely that you have some symptoms and perhaps don't realize it, that is what's going on. But let's say you do know all the symptoms and you truly are not getting any symptoms in relationship to these conditions. I don't know that I would even treat them because a lot of times numbers are incorrect. I love tests that are right on the mark, but I also find that plenty of times these tests can send us down rabbit holes. So we have to be a little careful about that.
Okay, let's see.
Let's skip over that next one.
Okay, please share with us how long it took you to cure yourself and share the ups and downs and any tips. That would probably be a very long story, but off the top of your head, what would be?
Yeah, no, I'm not going to give a long story. I'm going to talk about how I was very sick for many years from the time I was 6 weeks old. And then all the way through childhood into about 20 years old. Then in my 20s, as most people have experienced, not everyone, but many, there's a grace period. The 20s are truly a grace period, and I didn't feel too ill during my 20s. Had some mild allergies, but not much to write home about. But at my late 20s and going into my early 30s, I started to get quite sick and had taken far too many drugs and had caused lots of trouble. And I had gone to many doctors. I went to Yale University. I went to, I have several cousins who are doctors. I went to them and their colleagues. I traveled to find doctors. I went to clinical ecologists, which are today called functional MDs. I really did a lot of work, went to Toronto, trying to find out who could help me. And it wasn't until several years later that I found someone who was a homeopath in my area in Western New York. And she gave me one medicine, believe it or not. It was Nux Vomica 200C. Or actually, I think in those days it was 200X because that's all that was available around our area. And it uprooted about, I'm going to say about 40 to 50% of my condition. It was amazing. After all those years of suffering as a child and then in my 30s, it made a huge difference in my life. And then from there, that last, I don't know, 50 to 60% took a lot longer, but at least I was past the migraines and the horrible constipation and the horrible anxiety and some of the asthma, most of the asthma. And then I was left with chemical sensitivities. And the ups and downs were, I went to many practitioners of all different sorts all through the years. My mother was, because I was so sick as an infant, was always looking for alternatives and used reflexology and diet and you name it. She tried a lot of things that were available to her back in the early 50s. And so I grew up with a mother who was very interested in trying to help me through alternatives. So I had been through all of those methods, supplements and vitamins and herbalism, etc. And each of them offered a little bit. I think herbs were one of the most valuable until I found homeopathy. And then that's what really turned me around. And then I used homeopathy from that time forward and never turned back. I don't know, was that too lengthy? All righty, let's go to the next slide.
Yeah, we can go to the next slide.
All righty. Okay, why use lycopodium twice in a protocol, LycoRs and LycoPlum? Why not use LycoRs and then just Plum Bomb? Because they're two different protocols for two specific different conditions. However, having said that, I like to try to make it as tight as possible, and I found that through the years of using these combinations, that choosing the one that has the grandest condition, the one that is causing the most trouble, will often clear up the others. So we use LycoRs for bloating and gas, and we use LycoPlum for constipation, and especially constipation, which it could be a couple of days before someone has, several days before someone has bowel movements, between bowel movements. And a lot of times just one of them will work for both. So I have used both in one schedule, but I try not to do that any longer. I try to keep that really simple.
Okay, LycoRs and LycoPlum for constipation. If taking the OHM combo in both, is that a double dose of lycopodium?
Yeah, in a way it is, but what we're trying to do is keep it tight, just like I just explained a moment ago. Let's keep it as tight as possible and tidy, and try to use only one if we can. But yes, we are getting a double dose of sorts, because these combination medicines, lycopodium by itself is a different medicine than LycoPlum. Lycopodium is a different medicine than lycopodium and arsenicum mixed together. So they do have they have components of each other, but they are indeed different medicines. So we try to, but indeed, in spite of that, we still try to keep it as simple as possible and choose one if we can.
Is there a benefit to taking pre-mixed remedies, such as LycoPlum, over combining pills to make a dose?
No, it doesn't make any difference. It's just less expensive.
For a mixed remedy like LycoPlum or LycoRs, can we put both remedies together in one jar of water?
Yes, you may do that.
Is it okay to combine remedies from two different companies or two different pharmacies to make a mixed remedy?
Yes, they're standardized throughout the world.
Can we just take 4 pills of one remedy and 4 of another at the same time instead of having a pre-mixed compounded remedy?
You bet, absolutely.
What is the most effective way to take remedies that have been prepared in water or alcohol when you purchase them that way? I've heard everything from directly under the tongue to dilute in 4 ounces of water.
Well, you can do it. You can put it into 4 ounces of water, but when I use a lot of remedies in alcohol for the care of my mother, and because it's just easier for me to administer it to her, so I just put the alcohol directly into her mouth. I don't want to take a chance that she's not getting, that I'm not measuring properly, and of course I would be able to measure properly, but I just make it very convenient for myself and just put it directly into her mouth.
Is there any difference in taking a liquid form over pellets? Do you know why the Banerjees sometimes specify that remedies should be taken in liquid form?
Yeah, there is a difference. Yes, that's why they say use this in liquid and don't say anything about the others, which means the others are in pilules and the liquids really do make a difference. Otherwise, they wouldn't make it clear that way.
Do you really put vodka in your kit remedies?
You know what? I don't know what that means. Maybe it's because I discussed keeping vodka on hand in my first aid kit. I keep, a number of things. I keep salt and, a needle and alcohol.
Maybe it was when you were talking about making a liquid remedy, or if you had to stretch a remedy for some reason, how you would get it to last
yeah,
longer.
It could be that. Certainly, yes, it could be for that reason. Maybe that's what I was discussing.
Yep, you use a very high proof alcohol, or grain alcohol, or very high proof vodka, right?
Yes, that's right.
Something like Everclear or something.
Yes.
Can remedies that are stretched by mixing in liquid or grafting be used again to make more in the same way? My concern is when or if remedies become unavailable and I don't know ahead of time what I will need.
I discourage people from stretching remedies for a couple of reasons, but certainly in a pinch, if you have something that's no longer available or you've run out and you need more of it, then by all means you can stretch it. Or if everyone in the family has got a flu and you only have one little bottle of Roostox or whatever, you may need to keep that going until you can purchase another bottle. Then by all means stretch it. But the reason I prefer that people use them directly from the bottle is because the pharmacist really knows what he or she is doing. And I think it's always better to leave it up to them to do it that way. The second reason is I want all of us to buy directly from the pharmacies and not cut them out. It's not that we are cutting them out necessarily, but we're cutting out an aspect of their work. We need these pharmacies to survive. They are the blood flow of our practicing homeopathy on ourselves and our families. So it's very important that they stay alive, and they are often under attack by those powers that would prefer that homeopathy not be around because it cuts into their profits, and they have the ear of the government, the FDA, etc. So we don't have the ear. We are not high profit companies that protect or that supply us. So we need to protect these pharmacies. And the best way to protect them is to keep their bottom line running in a healthy, robust way. And that is to buy remedies directly from them as often as possible. All right, and then that's what was, yeah, go ahead.
Do you have any thoughts on Thompson's Homeopathics in Toronto?
Yes, I do. Yeah, they're a fine company. All right.
Okay, next slide.
Yep.
Banerjee protocol medicine questions. Does a combination remedy shift healing towards a specific part of the body or a specific organ? For example, with colitis, if I use mercurius and ipecac, would that give a direct gastrointestinal result over mercurius working on an ear problem? Why is a combination remedy different?
Well, it harkens back to what I just said a little while ago, that they are different because they're combined. As soon as you combine a medicine, at least with the Banerjee protocols, they become a different medicine. So if someone has a ear problem, the mercury mixed with the ipecac may indeed help that as well.
Yeah, I think also sometimes, remember we had a question in one of our recent classes where somebody was confused about a remedy like coffea, how it could help with insomnia, and then something else too that was more physical, like itching.
Okay.
So a remedy might cover more than one organ or more than one complaint.
That's right. That's right.
Not just the fact that it's in combination.
Yep, that's right.
Why do Banerjees use tinctures along with remedies if those tinctures are also in homeopathic form? Oh,
so they're talking about the botanicals that they use that are in tinctures.
Well,
because
I
think that's what they're saying. In other words, why use Crataegus in mother tincture form when you can use Crataegus in 30C?
Maybe, but I think maybe they're thinking that mother tincture is homeopathically diluted, or possibly not. But you could explain that a mother tincture is just the same as any other kind of herbal tincture you might buy. It's not homeopathically diluted.
Right, right, right. Well, it seems as though it's. Let me just make this really clear. When I was seated with the Banerjees and with the other senior doctors through those 9 times that I was there in India, and I was jotting down every single case I observed, and I jotted down every case. I never asked them, why do you use tinctures when you can use the homeopathic? Because I knew what the answer would be. The answer would always have been the same, because this is what works. So they have found through their 150 years, 1,200 cases per day, 7,200 cases per week, that this is what works. So that's what they use. And that will probably answer many questions that you might have. Why do the Banerjees do this instead of that? Because they've found that through this kind of case taking, with all of these years, decades, over a century, that this is what works best. And they fine-tuned it nicely.
And it would be worth reminding everybody that a mother tincture, is not the same as a homeopathic remedy that is in liquid form.
That's right. And we use both. We use, so if it says tincture or mother tincture, then it's MT generally, or sometimes we use the omega symbol, but it's, and we might use that along with Nux vomica, for example.
All right.
In a 200 potency.
Yeah. Well, that's the next question. Do the Banerjees use Nux vomica 200C for gut issues? If so, in what types of cases and what dosage and frequency?
We most often use Nux vomica in a 30 for many of the gut cases. And so, but we do use 200. I don't know that I can answer that without going through an awful lot of cases. It might be for alcoholism. I'll give you a couple of them. Might be for eating foods that were a bad food from a restaurant. It might be from someone who is quite irritable and gut problems. It might be for something that is from drinking too much alcohol, even if they're not alcoholic. It might be from eating too much chocolate and having a reaction. So I don't know if that answers your question, but there's a lot more. And what I would do is, if you want to know the whole aspect of Nux vomica, you read your Materia Medica. It may not be exactly how the Banerjees use it, but you'll get a real good picture of it by doing that.
Can children or pets use remedies in alcohol or tinctures with alcohol?
Yes, they can. But babies, I would be, where are you, Lara?
That was a live question that came in.
Oh, okay. Yes, I give Buster, my dog, Crataegus in mother tincture. I put it in his water, and that's what he drinks throughout the day. He drinks his, it's hawthorn, and it's an alcohol. Now, a baby, I'd be a little more careful about that. I would put it in water and give a very small amount, because alcohol is not a good idea to give to a young child.
Okay. So here's an example of one of those 2 different potency questions. Sometimes you use Lyco Rs 200 and sometimes Lyco Rs 6. Can you shed some light on which to use when?
I am more in the past few years, since we've put this together, I more often use Lyco Rs 6. And it can be used both ways, but I find that not only have I had better success with it with arsenicum as a 6, like a podium being a 200, but also each time I've gone back to Calcutta, I find that they use it more often that way too. So I think both would act, but I seem to be weighing more on the Lyco R6.
In class 2, you recommend Bovista 200 every other day for gluten and other intolerances, but in most of your cases, you usually recommend Bovista 200 twice a day. How would a person know which way to go?
Well, Bovista is a remedy that's specific for food intolerances, but also allergies. And so if we see a very strong preponderance of a need for Bovista because they have food intolerances and allergies, and that is the essence of the case, that's the bottom line, is the problem is food intolerances and or allergies, then I'm a little more aggressive and I might use it twice daily. However, if it's kind of a background condition, then I might use it a little less frequently, such as every other day. But both will most likely act. Okay, that was the same question next time around too, right?
Yeah, so the same thing with when is it more appropriate to use lycopodium? Oh yeah, that's pretty much the same one.
Thing. Okay, great. Go to the next
this
slide.
Was, yeah, okay, so we'll go to the next slide.
Okay. Assessing case questions. Yep. Love it. So remedy, the question was remedy acts for a time, but condition is not gone. What is the next step? Increasing the potency, change the remedy, move to the second line. So the person who's asking this question has apparently done some studying in, or maybe a lot of studying in classical homeopathy. We don't use classical homeopathy. Doesn't mean that I don't consider some aspects of it, but this is not classical. We're using the Banerjee protocols, which I have, since the time of putting this case out originally, have coined as practical homeopathy, because I've added my own protocols in here as well. So we don't generally change potency. So it's very occasionally we do. Sometimes we see it with Cantharis for urinary tract infections. We start with a 30 and we might go to a 200. But generally speaking, we don't increase the potency. The protocol is the way it is. If it says it's in a 30, then you use it in a 30. If it says to use it in a 200, we use it in a 200. If there is no, if the remedy acts for a time, and this is kind of vague, the way this person is putting this. If the remedy acts for a time, but the condition is not gone, what is the next step? I would say the next step is patience. Because a lot of times we expect it to be gone, and it maybe is going away much more slowly. Remember, folks, that if you're taking a remedy and you're seeing about a 50% improvement, not unlike what I described about myself when I first took that Nux Vomica. If I saw a 50% improvement after 2 months, which was pretty dramatic, by the way, if I see 50% improvement over the first 2 months, and then the next 2 months, I see another 50% improvement, it's a smaller amount. It's still 50%, but remember, we're starting with a smaller number. So our percentages are proportionate. So it might be a smaller amount and you may not notice it. So I always urge people, be very careful before you abandon a medicine, especially if it's acted. Be super careful. Your expectations might throw you right out of sync with using exactly what you need if you just had a little more patience and put up with it a little bit longer, or even a great deal longer. So I'm going to reiterate that time and again tonight. I think that's so key. We are an impatient human race. It's not our society necessarily. I think all humans are impatient. I saw it in India. I see it in, I work with people from all over the world. And I will tell you that I see impatience because, of course, people want wellness, and I can't blame them. But in their impatience, they often make rash decisions and say, oh, well, this is not good enough. I really expected more. Don't expect more. Expect perhaps a little bit grander in the beginning and a little less improvement, and a little less improvement, a little less improvement, but still improvement nonetheless.
I'm going to interject with another one of the live questions because it's relevant to what we were just discussing. Mm-hmm. Yeah. For gastro, for the slide in Good Gut, Bad Gut that gave a protocol for gastro with palpitations, the protocol was Lycopodium 200 mixed with Arsenicum album 3X. Is that one of the examples where there was a misprint in the Banerjee book, or maybe this was before the book, but they're wondering if the 3X in that protocol
is better than that's correct. No, that's correct. No, the misprint was, the misprint was the, as I recall, it's been quite a while, but no, I do not believe that's a misprint. No, I think that's
so in this case, 3X would be better to use than 6 or 200 for this particular protocol. Okay. For chronic issues, if a year sees little improvement, do you continue the protocol as is, increase potency or frequency, or switch to a second line?
I think we kind of answered that a little while ago, but if you see it's little improvement is still improvement, folks. Remember, be careful with that. But if you see no improvement, then switch to the second line. But give it the full measure.
Could you talk more about Herring's law of cure and how you see chronics abate using the Banerjee protocols? For example, 3 gut and 1 cystitis protocol started 4 to 5 weeks ago. Mentals improved, insomnia improved, physical symptoms steady improvement. But now acute old symptoms are plaguing, pinched nerve, cold cough, mild skin issues back on face. Could this be progress?
What does that, I mean, to anyone listening to this, it sounds to me like great progress. Absolutely. Mentals improved. Mentals are everything, folks. That's key. Super important to see mentals improve. Insomnia improved. Beautiful. Physical symptoms with steady improvement. Now acute old symptoms are plaguing: a pinched nerve, a cold cough, mild skin issues. Mild skin issues, a cold or a cough, a pinched nerve. Now, it depends on how severe that pinched nerve is. If the person is laid up in the hospital because of the pinched nerve, then I would say, now we've got to weigh this out. But pinched nerve, take hypericum. Cold cough, take aconitum bryonia. Mild skin issues back on the face, leave it alone. That, I would say, there's been great progress. See, this is a case of not being able to assess what improvement is. And I'm so glad these questions are being brought up tonight, because that is key, being able to assess. You know, I always tell folks, the easy part about homeopathy is the knowing what remedy to use, because I give it to you. The easy part is knowing what potency to use, because I give it to you. The easy part is knowing how frequently to use it. I give it to you. This is the hard part. What am I seeing after 8 weeks, 10 weeks, 13 weeks? What am I observing? And if you didn't keep a record, and I don't mean a daily record, I mean if you didn't keep a record as to how severe that gut was, how severe that mentals were, how bad that depression was. Give it a number. You assign a number to it. It's on a scale of 1 to 10. That depression was a whopping 8. You want to put that in your notes. It's an 8. Today I feel horribly depressed, and I've been feeling like this for months. Put that in there, so that in 8 to 10 to 12 to 13 weeks later, you can compare it and overlay, so you can make those 2 comparisons. Insomnia was horrible. It was every night. You want, and I don't want you to say it to write it posthumously. I want you to write it as it's happening when you take the case, so that you can compare it with integrity. No, that's not the word I'm looking for. With accuracy. So you want, as you're taking the case, you write those down so that you can compare them and overlay, so that you can see them in 8 to 10 to 13 weeks later and say, yeah, wow, look at all that improvement. A cold, a cough, mild skin issues, pinched nerve, beautiful. We're moving on. We use remedies that are related to those conditions. And I don't look at it as Herring's law of cure. I look at it as simply use the medicines that are needed for this group of conditions.
Here's a similar question. If while doing a protocol, there is a return of old symptoms, but they are short-lived, yet the primary condition has not yet improved, do you need to stop the protocol, or should you continue?
No, you don't need to stop the protocol. You can stay with the protocol if the conditions that present now are very trying, then treat them. If there's something that can be ignored by just going on with your day and pushing it out of your mind, then do that. No, they can both be used simultaneously, however, if need be.
When do we need to work on miasms?
Well, these medicines are always working on miasms to a certain degree. You know, Nux vomica is miasmatic. Tuberculinum is miasmatic. Bovista is miasmatic. Calcarb is miasmatic. So we're automatically doing it. No need to worry about it. Unless you want to study that, that's classical. It's certainly interesting, but we don't parse it out the way we do in classical. All right, I'll move to the next slide, Laura.
Yep.
Okay.
Okay, these are all the is there a protocol for that we decided to include. I don't think you're going to necessarily give protocols for all of these tonight, but you did want to address some of them. So is there a Banerjee protocol for diabetes, and is there one for MS?
There is one from MS, and the one that's for diabetes, remember you're using, don't get stuck on a specific word or a specific name for disease. If a child has an ear infection and you want to know how to treat it, and you want to go on my website, on my blog, and find it there for free, of course. And I don't have it written as ear infection, of course I have. But you need to know the synonym for that. What's the synonym for that? It's otitis media. If you have a strep throat and you want to find the answer, you go to the blog and you look up strep throat. And if you don't find strep throat, don't say, oh, well, it's not here. No, look up sore throat or infected throat. Look for the synonyms. So another synonym for diabetes is blood sugar, and it's in the course.
Okay, are skin tags a result of gut problems, and is there a Banerjee protocol for them?
There is a Banerjee protocol for skin tags, and you can find that in the, there are a couple of them, in my course called Skin the Ugly Truth, if you're so interested, and as a result of gut problems. I don't know. I mean, this is the difference between homeopathy, at least this kind of homeopathy, this very practical way of looking at homeopathy, and naturopathy or functional medicine, where they're always looking for who caused this? Well, how did this start? What was the reason for this? We don't necessarily do that. Instead, we look at skin tags. Instead of going right past the most obvious, here's the skin tag, going saying, oh, it must be, maybe it's a food problem. Maybe it's overgrowth of yeast. Maybe it's the MTHFR. Maybe it's all of them. How do you know which one it is? And then if you choose those to treat, you might miss the whole point. You might not get it at all. Just go for skin tags, the homeopathic protocol for skin tags, and use that. And it clears up anything that might be back here if they even are indeed related.
What at the end of video 4, somebody asked a question about a leaky bladder from walking, sneezing, coughing, etc. Joette, you said to use the bladder protocol, and the bladder protocol that was discussed in class 3 was for bladder kidney cystitis, but it seemed to be more for infections. Would you still use this protocol since leaky bladder isn't an infection? The protocol involved the use of metarhinum, and how long is it safe to use metarhinum?
Yeah, use the bladder protocol. It can be for infections or otherwise. So yes, it can be used for both for leaky bladder and also for infections.
Now you said you would use metarhinum, but not necessarily in the same fashion. Do you remember what you were thinking?
Yes, I would. Yeah, no. It's a lot of times we use metarhinum when there's an infection twice daily, or sometimes we even use it as often as every 12 hours, because 12 is twice daily. But we might use it more frequently than that. But for just a leaky bladder, then I would use it, every 3 days or something close to that, much more infrequently. It's not an acute. We don't use it as often. And what was the second part? Oh, the Banerjee is only used for a short amount of time. Well, we use it until it's done, until the condition is finished.
Let's see, do the Banerjees use it? I think that, didn't the Banerjees say for some certain things like urinary tract infection, you should continue using it for at least 2 months? Is that what it was?
Yes, and that I think we talk about that more thoroughly in, what is it? Alternative to antibiotics, maybe, or feminopathy.
Yes, and also feminopathy, both of them.
Yeah, both of them. Yeah, we talk about it very extensively.
Feminopathy goes into quite a lot of depth on interstitial cystitis. Somebody asked whether interstitial cystitis is the same protocol as regular cystitis.
I'm sorry.
That's covered.
Yes. Do I? Okay. I was just my husband just gave me a note that said our son is coming in from out of town tonight, and he just said He's coming
So
in. Hey, so I was reading that instead of listening to you. I'm sorry.
is the protocol for interstitial cystitis the same as for infectious cystitis, like UTI?
No, it's a little different. It is a little different. It's the same remedies, but they're used a little differently. And I don't know that we want to get into it tonight because we really are not covering that. But it is.
If you really
same remedies.
If you really need that information, there's almost half of a class that covers that in feminopathy, plus it's mentioned in other classes in feminopathy. It's covered a lot in that course.
And not just there. I think I have something on the blog. So check that out on the blog too.
Are there any other protocols for bedwetting? I tried Menarinum with no success for my 8-year-old son.
Oh yeah, there are lots of remedies for bedwetting. When we give you a protocol, it is the first remedy that shows success in approximately 85% of those people who have that condition. That's what the Banerjees have concluded after using these medicines clinically for over 150 years. So the first protocol doesn't mean it's the only way to skin this cat. It's just the one that skins 85% of the cats. So what it means is that if it doesn't act, we've got plenty more to consider here. And we go to the second protocol. And if that doesn't act, we go to the third protocol, if there is one. If it doesn't, then we crack open a repertory and look at what the remedies are that are used in addition to those others that might have been considered.
Okay, I have a friend with celiac disease. She has bloating, diarrhea, and heart palpitations when exposed to gluten. Is there a Banerjee protocol for celiac, or should it just be treated by treating the bloating and diarrhea as needed?
We use the symptoms at most readily. In other words, those are pretty clear symptoms. Bloating, we use Lyco-Rs most likely. Diarrhea, we might use arsenicum, or there are others that we've used in this class. Heart palpitations, we might use Crataegus, etc. So we're going to use remedies that are specific to the condition. That's how we treat celiac.
Should someone that has silent reflux follow the same protocol for reflux? The symptoms are not the same. If not, what protocol should be used?
Well, we go by what the symptoms are that are presenting. So often silent reflux has something, even though it's called silent, has something that presents, and then we would use those symptoms. So whatever symptoms are present, that takes priority over the reflux symptoms. That's the way to look at it, always.
Do you suggest a remedy or protocol to use regularly for someone who has had their gallbladder removed, or should they just supplement with enzymes and bile?
Oh, they should definitely supplement with bile. They need to have that on a day-to-day basis, probably for the rest of their lives. Now what we do is look at, is the person suffering from any conditions, whether it's as a result of the surgery or otherwise. And we use those symptoms to determine which remedies we use.
Okay. Can you please give more suggestions for extreme sugar cravings?
Yes, syzygium, I don't know if we include, I'm pretty sure we included that. Syzygium, mother tincture, S-Y-Z-G-I-U-M, syzygium. It's in mother tincture. And I use that most often when there's sugar cravings and it's not extreme, or we have a lot of homeopathic medicines, then we use syzygium because it is a botanical, and we don't want to use as many homeopathic medicines. We'd rather keep some of them in homeopathic and try to balance it out with a little bit of botanical. So syzygium helonius 200 we use, nat phos 6 or 3, 6 or 30. And if there is bloating or extreme, or someone has extreme low carb diet, that is often going to happen. So that's the way I would approach it. And remember, we have to ask, what is a craving? Be careful. There's nothing wrong with desire for sugar. I'm going to be honest with you, unless it is over the top. There was a time when we thought there was something illegal about craving fats. And it was that we were all deprived of them because we all went on the Harvey and Marilyn Diamond diet back in the early 70s. Of course we were craving fats because there were no fats in the diets we were eating. We're only eating pasta and fruit. So be careful that you're not labeling something as an illegal or a negative, when indeed sugar, depending on what you mean by sugar too, is not necessarily all that bad for us, especially if we're, taking it in the form of blueberries, strawberries, bananas, oranges. We don't want to overdo anything, but we want to have some balance to that.
Can someone self-diagnose for the thyroid protocol?
That's a difficult question to answer because I don't know who the person is. In other words, if this person has a lot of experience in anatomy, physiology, pathology, and says, I feel pretty confident this is probably a thyroid problem, then yes, I would say go for it. But without some kind of good background in this, I would not just guess and take it.
Okay, what is the Banerjee protocol for nipple thrush?
Where are we on? Okay, here we go. This is a question that goes with skin conditions. And since I think the reason they feel comfortable asking this is because yeast is considered a gut condition. But
this person says it feels like gluten, dairy, and even kefir make it worse.
Okay. So if there is a condition in which the person can't eat gluten or dairy, then we use remedies that are specific to gluten and dairy. There are protocols for nipple thrush, but I find that using that in addition to the gluten and dairy protocols is the best way to approach this. You will find nipple thrush protocols that are across the board throughout the world. I think I might have it on my blog. If I haven't, then just look it up online and you will find it pretty quickly. The same across the board, pretty much.
Is arthritis a gut issue? How can one heal this?
Well, arthritis is a gut issue if arthritis is a gut issue. In other words, if you see that you eat gluten and your joints start to ache, then it's a gut issue. If you see that you eat gluten and then you don't eat gluten for long periods of time and then still have arthritis, then it's likely not a gut issue. That's one, I'm oversimplifying this, but it does not necessarily mean that it is a gut issue. Arthritis can simply be inherited. Arthritis can happen as a result of running into, for too many years. So you can get arthritis. So no, it's not always a gut issue.
Now the Good Gut, Bad Gut course did cover some Phytum 200 mixed with Rhus Tox 30 for joint problems.
That's right. That's right.
How is laryngopharyngeal reflux treated?
Just as reflux. Just use the protocol for reflux.
Okay, is there an obesity protocol, and will calc carb cause weight gain?
It was so interesting because there was a long discussion a while ago about someone saying, every time I take calc carb, I gain weight. I think the problem is they're taking calc carb and they're not supposed to. Go ahead.
This question might actually have been, can you use calc carb to prevent weight gain or treat weight gain? It was phrased, very shortened because they wanted to fit a bunch of questions in.
Okay.
So I don't know which they meant. Yeah.
Calc carb can be used for weight gain if calc carb is indicated for other conditions as well. So we're not going to use it only when we have weight gain, although it occasionally can be used for that. But generally speaking, we like to use calc carb for a myriad of conditions, and then weight gain is one of them. And is there an obesity protocol? Yeah, it's Graphites, 1M daily. Now, I have found that protocol. It's a Banerjee protocol. I have found that protocol wanting. I find that there are others that are a little bit more valuable, and NatFast is one of them, and LicoRs if there's bloating, LicoPlum if there's constipation, and inadvertently the weight starts to drop off. And I'll also give you a great tip. I believe a lot of weight gain when it's over the top, especially if someone says, I eat emotionally, or I eat because I'm bored, or I eat for some psychological reason, is usually the need for Ignatia. And a lot of times Ignatia, just taking Ignatia, will help someone drop some weight.
All right, ready for the next slide?
Sure, here we go.
Okay, cell salts questions. There's only 2 of them here. If you take 3 cell salts together, is that considered 1 remedy or 3? And I think maybe they're also thinking about, you know, when you have, say, 5 protocols you're doing, how much is too much?
No, I see 3 cell salts together as 3 separate remedies.
So if you were already taking, you know, 3 protocols, some of which had 2 mixed remedies, would you go ahead and take all 3 cell salts, or would you try and limit it?
I would try to limit it. I would try. We're always trying to look to make our schedule as tidy as possible and see if we can find medicines that will cover more than one condition and not give it just as an extra bonus. Let's just throw this in too. Let's not think that way. Let's think more in terms of keeping it as tidy as possible.
Which cell salts do you like to use for food allergies?
Nat Mur is very good for food allergies, especially if it shows up in skin conditions. Nat Phos is great for food allergies. Nat Sulf can be for them as well. There are a number of them. I'm sure I'm missing some, but those would be my top 3.
Okay, we can go to the next slide. All right, questions about individual medicines.
By the way, these photographs that we're looking at with the remedies and the pharmacists and all of that are all directly from the Banerjee, one of the free clinic that I would go to at night, where the pharmacists and the homeopaths we would all work together in one room where people would line up right out onto the street, and we would just take cases for free. Actually, I shouldn't say they, because I did not speak the language. If there was someone who spoke English, then I would be happy to get involved, but otherwise I didn't understand the language.
Okay, should everyone who has had vaccines take Thuya? What warrants the use of this protocol?
Well, if everyone who has had vaccines would take Thuya, that means the whole world would take Thuya. And that would be because of Bill Gates. And I'm being a little facetious here because he thinks vaccines are the bee's knees. He's a do-gooder that doesn't know when to stop. But at any rate, what warrants the use of that protocol, I don't know if you can hear me, so let me move my microphone a little bit. What warrants the use of that protocol is if there is damage that is clearly indicated as a result of a vaccine. So I had a chickenpox vaccine 25 years ago, and you know what? I don't think I'm well because of that. That's not good enough. We want something where someone got a chickenpox vaccine last week and now they're as sick as a dog. Now that's warranted.
Okay, I just discovered how many forms of mercurius OHM offers: sulfuricus, solubilis, iodatus, dulcis, cyanatus, corrosivus. The form is usually specified, but if the protocol just says mercurius, how do we decide which to use? I think I've heard you say, and your Materia Medica suggests that Merck Sol and Merck Sin are interchangeable. What about the others?
Merck Sol and Merck Vive are interchangeable. Merck Sin is a completely different medicine. Sol and Vive, Merck Sol, Merck Vive are interchangeable. What about the others? Oh yeah, they're all remedies. I don't use them very often. There are lots and lots of different medicines that I don't use. You couldn't possibly use them all. They say there are about 6,000 of them, and I don't use 6,000 medicines. I probably use maybe 100, because I find that those 100 do just about everything.
In Good Gut Bad Gut, I noticed sometimes it says Ipecac mixed with Merck Sol, and then some with Ipecac mixed with Merck Sulf. Can you clarify?
Well, for the most part, it's Merck Sol. And I have used it in as Merck Sulf, but I'm going to suggest that you spend your time using Ipecac with Merck Sol, because through the years and having put this together, I found that one works more efficaciously than with Merck Sulf.
So mercurius solubilis?
That's right.
Okay. Are there instances when tuberculinum may be used twice a day, or is twice a day too frequent for this remedy?
No, we can use tuberculinum twice a day, and I believe it's for, I have to think, is it colitis? No, it's
You were
Crohn's.
thinking maybe, is it Crohn's?
I think it's Crohn's. I'm almost positive it's Crohn's. But that's the only time I would use it, twice a day, because that's a very specific protocol that the Banerjees give.
Okay, Crataegus oxyacantha isn't in any of your cases in good gut, bad gut used for gas or bloating.
No, I don't use it for gas and bloating. I use Crataegus for cardiac conditions.
Okay, Teucrium isn't in any of your cases for parasites. Why is that?
Because I find that, I mean, we can use Teucrium. I use that as generally a second protocol or second line if Cinna doesn't act. I usually start with Cinna.
Couldn't everyone benefit from taking Bovista and Ignatia?
No, it's not so. Not everyone has allergies. Not everyone has food intolerances. Not everyone has grief, sadness, anxiety in the same way. However, if we're going to choose one in which most people, or many, not most, many people would be benefited by, it would be most likely Ignatia. Because everyone, all of humanity, and the animal kingdom suffer emotionally from sadness and anxiety and or depression at some time in their lives. Not everyone has allergies or food intolerances.
So I think we go into this in a lot more depth in the mindful homeopathy course.
Yes.
But just feeling sad isn't necessarily a reason to run off and get Ignatia.
Right.
You know, it has to be impacting your life in some
It
way.
has
You
to
don't
be
want to be
pathology.
emotional,
Yes.
or you don't want to, you know, you talked a lot in mindful homeopathy about how, you know, part of the whole spectrum of being human is, you know, feeling a range of emotions.
Right, right.
Yeah. Can tuberculinum KOCH replace tuberculinum bovinum?
Yes, but I prefer to use, if you can get tuberculinum bovinum, I believe that tuberculinum cock is maybe only available in other countries. That could be the why that question was brought up. Yes, it can.
When should Nux vomica be taken if a person will be eating at a fast food restaurant? Before eating, after eating?
I don't generally use homeopathy prophylactically. It's very rare that I do that, and that's what that question indicates. Instead, I wait till there's a pathology. Unless that person knows that every single time they eat at a fast food restaurant, they get sick in a Nux vomica fashion, then I suppose I could accept that thinking. But if you're just going to take it just because, perhaps in case, I wouldn't go that route.
Would we still use camphor for an adult who has never taken a remedy before but has important meds that they're currently taking, for example, insulin?
So use camphor for adults who have never taken a remedy before but has important meds. We always start with camphor when we're opening a chronic case. So regardless of whether or not the person is still taking these important medicines, such as insulin, it will not interfere with the use of their insulin or other medications, but it will help clear some of the effects that are negative from those medications, leaving intact any benefits.
Somebody checked, and Crohn's is the protocol that uses tuberculinum twice a day.
Great, thank you.
Okay, so where were we?
Is it an 18-month-old too young to be put on Athusa if symptoms show dairy issues but no testing? Well, you're going to know better than many, many tests, to be honest. So no, 18 months is not too young.
What are the concrete symptoms for using Athusa, and usually how long would it be given? Well, the best way to know the symptoms for using Athusa is to read up on it in the Materia Medica. That's
right. Read the Materia Medica on Athusa, and that's how you'll know. And how long you use it is determined by how long you need it. So when it stops acting, or if you no longer need it, then you stop.
Because Athusa, in Good Gut, Bad Gut, you focus a lot about Athusa for dairy intolerance, but it's used for other things too.
Yes,
so
it's used for milestones, lacking in milestones that are not being met in children. It's used for sometimes for confused thinking. It's a wonderful medicine.
I'm guessing when they say usually how long is it given, they're probably focusing on for dairy intolerance, right?
Yeah, until the dairy intolerance is pretty much uprooted. It can be used for very long periods of time.
Can Athusa and Bovista be given at the same time?
Yes, they can, but we can, if we can possibly keep it tight, again, keep it super tidy, that would be great. So Athusa is for milk intolerance. Bovista is for food intolerance. Milk is a food. So if there is wheat intolerance, gluten, as well as dairy, then it would behoove us pretty much to stay with Bovista because we want to keep this as tidy and organized as possible. If, on the other hand, the person only has dairy intolerance, then Bovista is not as important, and instead we can concentrate on Athusa.
So this question ties into those. Will Bovista by itself clear possible dairy issues in a young child without using Athusa?
Yeah, yes, it certainly could. There is that possibility. And then if
So
that
you
doesn't
would
act and you don't see it fully acting after, if you don't see, not fully, if you don't see any action at all over 8 to 13 weeks, then you go to the next medicine. But you want to see something. If you even see the tiniest improvement, then you stay with that medicine. If you see no improvement, then you move on.
So if the main problem or the only problem is dairy intolerance, you usually start with Athusa, but if they have a whole host of food intolerances,
Then, yes,
you focus
right.
more on Bovista.
That's right. And not just food intolerances does Bovista cover. It also covers just allergies in general. Allergies to even, fur, dust, etc.
And this person asks, how long is Bovista given for toddlers? And I'm going to add, and for adults, and for elderly people, and for teenagers, and
for dogs, and for puppies, and for cats, and for birds, and it's for as long as it's needed.
Okay, we can go to the next slide. Gut questions. How many bowel movements per day is recommended? I have been told 2. Do you agree?
Yeah, it would be nice if you had 2 a day, but some naturopaths and clinical ecologists and other practitioners believe you should have 2 to 3 a day. And I always think, really? What if you work in in Manhattan in a big old building with all those people all around? You got to leave the room and go to the bathroom in a public bathroom. I would not be happy if that were happening to me. I don't think that there is a good number. I'm going to be honest with you. We look at pathology. We look at more than 3 a day is a little bit off. And after 3 days is a little bit off. Anything in between that range is within the range of normal. It is not pathology to go every other day. It is not pathology to go only once a day. It doesn't become a pathological problem, meaning constipation, until after 3 days. That's the definition of, medical definition of constipation. Now, what's optimal? That's different, but I would not treat something just to make it absolutely perfectly optimal. I would allow the body to do what it's going to do naturally and use food instead. Make sure you're drinking kombucha or have sauerkraut daily, a tablespoon of sauerkraut or something like that, instead of taking a medicine. And remembering, these are medicines, so we use them for pathology.
How many bowel movements a person has per day has a lot to do with how much they're eating. If somebody is eating very few calories, gut motility slows down because the body tries to extract as many calories from the food as possible. So everything will pass through the gut much slower, and that's normal, and that's what the body's supposed to be doing.
That's right.
Whereas if somebody, say you have a teenage boy who's eating 6,000 calories a day, everything passes through a lot faster.
Yes.
So
that's right.
That's
right.
It has nothing to do with, whether you're in
whether
good
you
health
should
or bad.
or shouldn't, right, exactly.
Are there any protocols for a sluggish bowel that works after intense massage over the ileocecal valve and or pushing onto the bowel, for example? Protocols for constipation besides what you list in Good Gut, Bad Gut, such as Lycoplum, Nux 30, Mercurius, Chelidonium? No,
I think these are all good remedies. That Lycoplum, Nux Vomica 30, Merc, Chelidonium. Nat Phos is another one. I think we talked about that too. So I think they're all in there. I mean, it's not all of them, There are others, but I think those are well chosen.
What choices do you have when you have diarrhea and then thicker stools and then it goes back and forth? What would you use for this? Lyco-Rs didn't seem to do the trick for me.
So I wrote something here. I don't even understand what I wrote. Do you know what that means, Laura?
I think you were saying to use the diarrhea protocol, even if it's not
Oh yeah, that's
consistently
what we're saying. If it's not always, it's still considered diarrhea. Okay. So if there is diarrhea, and it goes back and forth between normal and diarrhea, we're looking at the pathology. Normal is not pathology, but the diarrhea is. So we're going to use a medicine that is specific to diarrhea. So use that protocol.
Okay, for constipation in a 2-year-old, if Lycoplum 200 did not act after 5 weeks, is Lyco 200 mixed with Plumum 6 a better choice?
No, I would go to other remedies. I would go to Nux Vomica 30. I would consider Nat Phos. And it's not clear what they mean by constipation. Some people describe constipation as meaning that it's difficult to go, or it's incomplete, or it's infrequent. So it depends on what it is, which category we're talking about. But I would move on to something like Nux Vomica.
A 47-year-old female, currently in generally good health but with lifelong constipation issues, grew up the daughter of 2 MDs, so was given an abundance of antibiotics, at least 20 courses, tried the Lycoplum combination for 4 months with no relief, also tried Nux Vomica for 2 months.
If I were to take a case like this, I would have to say again, what is meant by constipation? If someone is in otherwise good health, what does it matter? Is one of the things I would be looking for. I'm not going to say that to someone, but I want to know about their life. Is this constipation, is this something that is, when they say constipation issues, it doesn't tell me how severe it is. It doesn't mean that the person's going every other day and that's considered constipation. And the reason I'm pointing this out is because that is a common misconception. I'm not going every day, so it must be constipation. Or is it causing distressing symptoms such as pain? Then we would look at remedies that are specific for pain with a gut that's not moving along. So is there anxiety or sleeplessness, straining, or hemorrhoids? So I would want to know more about the case before I would move on and discuss others. Chelidonium is one, just to throw it out there, chelidonium is another remedy that we can consider as well.
What is a remedy for irregularly shaped hard stools with mucus present?
There are the protocols in there for mucus on stools, so just look that up.
This wouldn't strictly be a pathology, so I think you would probably
it might not be a pathology. Irregularly shaped is not necessarily a pathology. Be very careful, folks, that our world is being shaped by the internet that teaches naturopathy, essentially. Be very careful with that, because what we always want to do is look at what is behind this information. More often than not, what's behind the information is to sell a product. So this is the supplement that we use for this condition. And these are not conditions that are necessarily worthy of treatment. Now, if they are worthy of treatment, then of course we move forward and we use homeopathy. But this brings me to something that we hadn't planned on really talking about tonight, but I think is worth our time. I teach these courses so that you have autonomy. And when people decide to work with me one-on-one, I will tell you, I'll be honest, my fees are not low. But my goal always is to teach folks how to fish so that they can learn to do this themselves. I want homeopathy to live and be well. And the only way that this can happen, in my estimation, is to see that folks are using homeopathy on their own as much as possible. Which is why I also put out my blog for free that we've been putting out for, 8 years, 9 years now. Every week we put this out, and I don't get kickbacks. When you go to my blog and it tells you, if you're looking up, food poisoning, for example, and you put in the little key word, food poisoning, and it takes you to the remedies that can be used. And you click on it, it will take you directly to Amazon or to Boron. I don't have an affiliate program with them. I've been offered that, but I don't take that. Because if I had an affiliate program, it would mean that every time you purchase that medicine through my blog, I would get paid. And when I tell you my blog is free, I mean it is free. It means that, no, I am telling you this for the purity of knowledge. It is not about me making an income. So, and it is a service to as many people who want to use this as would like. That's not so, generally speaking, on the internet. I also don't have advertisers along the side of on the sidebars. Same idea. If I go to, I love interior design, and I'm always looking at interior design blogs. And there's lots of great, interesting stuff for me to read. But along the side, it gives me the name of interior designers and people who manufacture lamps and sell fabrics and furniture, etc. If I click on that, that person whose blog I've been reading gets a percentage of whatever I purchase. I do not have that set up on my site. And I've done that very specifically so that it is very clear that my information, there's no hidden agenda. And I will be honest with you, I do want you to take my courses, but I'm obvious about it. And you know what you're going to pay for them, and you know if you decide you're going to work with me, what you're going to pay for, what you're going to pay. But if you decide to stay completely free and not spend a plum nickel on my site, or excuse me, in my programs with courses, etc., that is just fine with me. I want that to be a service to folks. So be very careful, because the information out there is, this is how many bowel movements we should have. This is what the Bristol-Myers should look like, what a normal stool chart should look like. This is what we should be eating. But you go to another blog and they tell you something different than what we should be eating. Some are high fat, some are low fat, some are high carb, low carb. You know, you can, some are abstinence. You could go nuts with all this information. Dig deeper and find what it is they're selling and be wary, because supplement sales are big money, big money. So be wary of that, and that's usually what's behind some of this. So that's my little spiel on on how I work and how many others work as well. You see, after having spent time with the Banerjees in their free clinic at night, I was very touched by that. And I have always given free information out, but never to the degree that I made the commitment to in the last several years. We've almost doubled our amount of information that we give away for free. And because I feel that not only do I need to give back to humanity because I have this information, but I am very worried about homeopathy. I'm concerned that it's not going to be alive, and I think that if this doesn't get out into the families fast, we could lose homeopathy again. And we did lose it in the US back in the 40s. It was slammed heavily by the American Medical Association and their minions. And I want to be very careful that that doesn't happen. And this is the only way that I know to give back. So be wary of paradigms that are selling.
Okay. So is there a protocol for random uncontrollable diarrhea with no abdominal pain but intestinal feeling to just go before it blasts out?
Yeah, it's the diarrhea protocol. Let's use that.
Okay. Is there a protocol for random rectal green slime that oozes out?
Same thing. I would also use that protocol.
Clarify C. diff with nux vomica, potency and frequency.
Didn't
we
cover that C. diff? Didn't we cover that in this course?
Sounds like you might have mentioned it in passing, but not given a potency
or
frequency.
Okay. So we would use 200, but there's an answer to when we would use nux vomica at 200 there for C. diff. I've used nux vomica 200 for C. diff, and I've used it twice daily. And the protocol for E. coli, specifically from food with intestinal distress. It is unusual for us to choose a specific pathology name of a specific microorganism, such as C. diff, and then choose a remedy accordingly. That's very unusual in homeopathy. But it just so happens that with C. diff, the symptoms are pretty much across the board, so we can do that. Now, when it comes to E. coli, now we don't use necessarily a specific protocol. Instead, we use what is the intestinal distress, what are the symptoms, and use those remedies accordingly.
Okay, please differentiate between nux vomica, Lycopodium mixed with arsenicum, or just arsenicum if one often gets stomach aches after eating.
I like arsenicum album for pain after eating. That is probably our #1 remedy to choose. If there's bloating and there's gas, then I'm going to use, and pain associated with the pain, then I'm going to most likely use LicoRs. If there is pain or discomfort in the stomach after eating, and the food is from something that's unusual for them to eat, such as restaurant food, or at someone's home that's in which they're eating, I don't know, Cool Whip or something instead of cream or something that they're not accustomed to eating, then I would most likely use nux vomica. Unless LicoRs trumped it. And LicoRs would trump it because there's bloating and gas, and arsenicum might trump the nux vomica because it's immediately after eating.
What do you suggest when there is bowel pain in the night and in the morning until there is a bowel movement? Can this be due to even mild constipation or dryness of the mucous membranes?
A bowel pain in the night. By the bowels, I wonder if they mean the rectal area, and if that were so, then I would use arnica. But bowel pain, maybe it means cramps. It's hard to say. I'm not sure I know how to answer that one. So another way you could look at it is that this is better from a bowel movement. It's another way to kind of turn this around instead of saying pain until there's a bowel movement, more that better from a bowel movement. It could be nux vomica because nux vomica there's often relief as a result of a bowel movement.
So this would be a good opportunity to go to your repertory and
yes,
look
thank
up
you. Thank you for that. Yes, if you have a repertory, then you open it up and look there as well.
So what you would look up first, the bowel, or would you look up pain? I can't remember how the repertory is organized.
Yeah, I would look up. Let's see, better after bowel movement. So you would look that up in rectum.
Yeah.
Or also you might also look at it as abdomen. And also pain in the night, abdomen, and then pain in the night.
What are the best remedies or protocols for constant distension from eating? No matter what is eating, there is distension.
Well, distension is another word for bloating. Remember, sometimes we have to use these synonyms. We have a protocol for bloating. So look up bloating, and that's, of course, LicoRs. So be a little more broad-minded in the terms that you use to name the symptoms.
What would you recommend for someone who has very smelly stool with no other symptoms?
My first thought would be to use nat phos. Sulfur comes to mind, but I don't know that I would jump on that. I would look at nat phos. And also, let me mention that a very smelly stool with no other symptoms, I would be probably pretty satisfied with that. Stools are, I mean, again, naturopathy tells us stools should not have a strong smell. But that can be something that can just be in passing, or it could be something the person's eating, maybe an awful lot of. Maybe they eat cheese every day, and if that's so, then you might consider the possibility of looking at, am I getting any other symptoms with this cheese, such as bloating, and then you can add a bloating protocol or a thusa because it's dairy.
I tried Lycopodium mixed with arsenicum for gas, but it's now very much worse. Is there a second line?
We didn't give a second line for that?
For flatulence?
Yeah, the second line might be Carbovegetablus. I'm pretty sure we gave our Carbovegetablus in this as a protocol. If not, then it would be CarboVeg. That's the abbreviation. It can be used in a 30 or a 200, and it's used twice daily.
Okay, let's go to the next slide.
Alrighty. Wow, we are only on slide 15.
Yep. So if you're treating gas homeopathically with, LicoRs or CarboVeg, will that also resolve underlying issues such as parasites or some other underlying cause of the gas like dysbiosis?
Yes, it will uproot the main condition. Now, parasites might be a little different. If we're talking about pinworms or tapeworm, and we know that they exist, then by all means we're going to use something else. We're going to use Cinna, for example. But yes, but generally speaking, it's going to uproot conditions such as leaky gut or overgrowth of yeast or et cetera, et cetera.
I can't remember if it was in Good Gut, Bad Gut or one of the other courses, but I remember we also gave an example about some interesting discoveries that scientists were doing where they were using parasites to cure ulcerative colitis.
Yes.
Basically, the type of parasite that they introduced into the person's system caused the gut lining to produce more mucus, and that mucus was able to heal the ulcers.
Right.
So
right.
It's kind of like a nice little reminder that, if you really have a parasite problem, obviously you want to treat it, but you don't necessarily have to worry about things if you're not sick or if you're not having symptoms.
I would be surprised if most of us don't have parasites. If we've ever had a salad, if we've ever had a salad, if we've ever eaten, and just foods, parasites are ubiquitous. So unless there's a pathology from the parasites, I wouldn't give it a thought. I'll be honest. I would not give it a thought. I know that's antithetical to many practitioners of the last 50, 60 years, but I don't believe necessarily that parasites are a problem unless they are a problem. Just like I don't believe yeast is a problem unless it's a problem. And we want to see something that's pretty obvious. Not assume that this or that is as a result of that, of the parasites or the yeast or whatever.
So I think you just answered this in the last slide, but somebody is asking if there are remedies for copious and chronic foul-smelling gas with no other major digestive issues.
Yeah, it's the gas remedy. Yes, you're going to look at the remedies that we talk about specifically for gas.
And if LicoRs or what was the other one you just mentioned, CarboVeg?
CarboVeg, but it's most likely LicoRs.
If they didn't work, that would be another opportunity to go to the repertory, right? And look
yes, ma'am. Yes, that's right.
What if I'm not certain that there are worms, but there is extreme rectal itchiness that makes me suspect parasites? Do I go ahead and use Cinna? What if there's teeth grinding in a 2-year-old whenever he's eating, or there's a sister who's taking Oramet for depression, but at the same time she's pale, thin, and eats too much junk food? Would all of these be opportunities to use Cinna 6, or do I need hard facts?
I would go with a little more factual. Now, the 2-year-old who's grinding teeth, if there's grinding teeth because of teething, that makes perfect sense. But if the teeth grinding is certainly a condition that's related to parasites. Let's see, extreme rectal itchiness. Extreme rectal itchiness, there are many causes of that. That could be a food intolerance. It could be eczema. It can be...
I heard from a doctor it could be a rectum that's too clean.
Oh, from using those wipes?
Yeah, if it's, too much soap and water even can just cause the dry skin.
Yeah, isn't that interesting? Yeah, I've also read in the past that coffee can sometimes cause rectal itching. So it's a specific kind of rectal itchiness. It's usually at night, or the preponderance of it is in the evening and at night. Evening meaning, 7 o'clock, 8 o'clock, 9 o'clock, 10, 11, 12, through the night. From around 6, 7 o'clock at night, that's when it usually begins. And it's a certain kind of itchiness. It's like I call it a pinch itch. It's not just an itch, it's a pinchy itch. And I would, as far as hard cold facts go, I would look, really, and use check your child. Check yourself to see if you see pinworms, because they are visible.
Do you have advice concerning what would be the symptom picture for the Crohn's Banerjee protocol? If someone suspects this disease but doesn't have an official diagnosis, is there a time when they could take the Crohn's protocol just based on the symptom picture being a match?
I would look up know what Crohn's disease is. I would want to be pretty certain before I started on that journey, particularly because, as we were discussing earlier, tuberculinum is used daily, and tuberculinum should not be used daily unless it is indeed Crohn's. So I would either get a diagnosis, or I would be really careful in making sure that this is correct and knowing the conditions and making sure it fits quite well. And then, without a specific diagnosis, I would stay away from the tuberculinum and use only the other medicines instead.
Do you have any recommendations for a symptomatic gallbladder problem, it's not gallstones, that has an emotional component?
Didn't we covered gallbladder? I'm sure we did. I'm sure it's in the course. With an emotional component, we automatically use usually Ignatia. And I think we talked
gallstones were covered in the course, right?
Yeah, gallstones and gallbladder are pretty much are interchangeable.
For
protocols,
for gastric reflux, GERD, is this just the burning in the throat or also the feeling that food is stuck in the throat? Is there an alternative if Nat Phos does nothing for the throat burn between doses?
Here's the thing.
Also, what if,
instead of guessing what GERD is, and we have a protocol for it, look up GERD and find out whether or not that fits what you're talking about. That's a better way to approach this. You don't want to say, gee, I wonder if this is GERD. Yeah, it might be GERD. I think I'll take this remedy. No, no. Remember, this is medicine, so we want to be sure that we're using medicine for a specific condition. Make sure it is GERD before you take the remedies for GERD. So now, is there an alternative? Nat Phos does nothing for throat burn between doses. In other words, the throat doesn't burn while taking it, but it does burn between doses. If that's what this person is asking, that means that we're not finished taking it, and it will start filling in the space of burning as the Nat Phos is being used.
What if there's a cough associated
with GERD? If some foods set off heartburn more, would this be a sign of Bovista, even though no intolerance? Well, I would call certain foods causing heartburn a food intolerance. So Bovista would most likely be called for. And what if there's a cough associated with the GERD? If the cough is pathological, meaning the person is really gagging and coughing, then I would use a cough remedy such as Ipecac 30 as an SOS, or a couple times a day. If it's a mild cough, that's just a little bit of coughing when they feel this and it's not a big deal, then I would leave treating that aside.
What remedy would you use for a hiatal hernia, and would it vary depending on the severity?
I think we covered hernias. Didn't we cover hernias? It's lycopodium and lycoplum for hernia.
So that's Lyco 200, Plumum 200?
200, that's right.
Twice a day?
That's right. And it would not,
Twice a day.
yes, it would not vary depending on severity, because remember, these are protocols. We use them according to the protocol, not necessarily according to the severity. It's pretty rare that we treat differently based on severity when we have a protocol.
Have you ever seen gut issues lead to lower back pain, and can the two be related?
You bet. I have seen that, absolutely. But you would treat the gut condition and how it's presenting other than in the low back. And if there's nothing but the low back pain, and you see that it's a food intolerance, then I would use perhaps Bovista, for example. And for low back pain, I would consider using Symphytum and Ristox. And I've got that on my blog, that back pain, and how to use that.
Have you seen success treating lab-confirmed SIBO with homeopathy?
Yes,
so
I
SIBO,
have.
What does it stand for again? That's blanking out.
Yeah, me too. But yes, I have. Yes, I have.
Intestinal bacterial overgrowth, right?
Yes,
So it's the severe intestinal
Yeah,
bacterial
it probably
overgrowth.
is. S does stand for severe, I think.
And you have seen success?
Yes, I have, absolutely. We use the condition and how it's the symptoms and how they present to determine which medicines. All righty, next one.
Yep.
Allergy and intolerance questions.
What does it mean when a food allergy shifts symptoms? Originally a
Oh,
stomach
excuse
ache,
me,
now
it's not
rhinitis.
severe, it's small intestine, excuse me.
Oh, you're
Small
right, yeah.
intestinal bacterial overgrowth, yes, sorry, folks. Okay.
What does it mean when a food allergy shifts symptoms? Originally a stomach ache, now rhinitis attack.
It means you use two different medicines, one for rhinitis and one for the food intolerance.
And how would you know that the food allergy is the cause of both?
Yeah, you don't really necessarily know. That's the thing. But if you do know, then you would use a food intolerance or food allergy protocol, and you would also use a rhinitis protocol. But if you don't know the rhinitis protocol, you don't want to use it or whatever, try the food intolerance protocol, food allergy protocol, and stay with that. And see how far you can get. Usually it doesn't finish it. You have to use the symptoms of what's coming of it.
For the creme de la creme protocol for food intolerances, I am confused regarding if you always need all three remedies. I would like to understand this protocol better. Do you always use carb, Bovista, and tuberculinum or serinum? How do you choose between those two or three? Should any remedies be stopped or continued longer, shorter than others, and how do you determine if so?
We don't always use calc carb. We more often use Bovista, but if it, and the same thing with tuberculinum and serinum. The reason you're confused is because you need to know a little bit more about each of the medicines. Read up on tuberculinum in your materia medica. Read up on serinum. Read up on Bovista and read up on calc carb. And that will help give you a little bit better understanding of how to choose. If the preponderance of the condition seems more like Bovista because it is so obviously a food intolerance and especially gluten or wheat, then it's going to be more likely Bovista. We use tuberculinum when we see conditions that are related to tuberculinum as well. And let's say the person can't have milk, but they crave it terribly. They love milk. Then it's going to be more likely tuberculinum. And the way you would know that is because you've read tuberculinum, and there it is telling you that in the materia medica on tuberculinum. If there is a condition in which the person is very cold all the time, and they have these food intolerances, and they are often depressed and sad, and they have skin conditions, then we know that serinum is more likely going to be chosen. So read these medicines, and that's how you're going to choose. To make it super easy, you can just start with Bovista. But with all of the differentials that I gave you with each of these medicines, use those and then read up more so that you know where to go with these. Tuberculinum, also, let me just expound on a moment as I think this through. Tuberculinum is often used for someone who had a history of a lot of sore throats and ear infections as a child, or even today, with having had pneumonia in the past, getting colds frequently, especially in the past, ear infections, eye infections, all of those kinds of infections come up. There's a lot of behavioral problems around tuberculinum when the person is a child, or they're super stubborn and angry frequently, or there are intolerances to animals. Such as fur or feathers, that's going to be more tuberculinum. Serinum is going to be someone who gets colds frequently. I just said that about tuberculinum, but serinum also has that. Frequent colds and coughs is more often serinum, but there are a lot of skin conditions that are related to it. Calc carb is immunity problems as well. The person's always getting colds as well, and they have food intolerances. Bovista doesn't have colds and coughs. Calc carb, serinum, and tuberculinum do. So read up on those and you'll be able to distinguish them more readily.
So when you're saying Bovista doesn't have colds and coughs, you don't mean that if you do have colds and coughs, you can't take Bovista.
No,
You
it does
just
not mean
that
that. It means
another
that if,
remedy that
right,
covers that.
right. We would use, if someone has, not that they've ever had a cold or a cough, means that if there's a preponderance of colds and coughs, then you might go more towards tuberculinum or serinum.
Okay, this is another question regarding that creme de la creme for allergies. So this person is asking regarding those combination of different remedies. A person with many food intolerances, including dairy and gluten, severe seasonal and environmental allergies, including feathers, animals, dust, mold, and rarely gets sick. Would you just use Bovista?
No, there's a good example. Then in that case, with seasonal allergies, including severe seasonal environmental allergies, including feathers, animals, dust, and mold, I would go more with tuberculinum, because tuberculinum really covers that animal feathers and animal fur and dust. Tuberculinum is great for that. So I might use both. In that case, I might use tuberculinum and Bovista.
Describe a true dairy intolerance warranting Athusa.
Someone drinking milk and vomiting, someone drinking milk and getting eczema, someone eating cheese and their nose stuffs up terribly right after they eat it, or with the cumulative effect of eating cheese several days in a row. Someone who has stomach aches after eating yogurt, someone who gets gas after eating yogurt or cheese or whipped cream, someone who gets nausea. Those are true allergies.
What if it's just something mental or emotional, like anxiety or sleepiness or something?
No, it still works. Yeah, that would still be part of it. Absolutely, yes. It's still food intolerance to dairy.
So there's a lot you haven't mentioned too. I mean, you could,
yes, I'm giving these as examples. That's right.
Yeah, so there's a pretty wide range of different things that would warrant using Athusa for a dairy intolerance.
That's right.
An allergic reaction to chestnuts, and this person has a known allergy to other nuts as well, that cause diarrhea right away, then tummy ache, sore throat, grumpy, and general unwell feeling 10 minutes after eating. What would you use for that type of reaction?
Well, first we know we can be pretty specific about using Athusa for dairy intolerances and Bovista for food intolerances in general, but very specifically gluten. When it comes to nuts, we don't siphon it out too much. We use remedies such as Bovista or tuberculinum, etc. So we're looking at, that's just a general food intolerance. And they get grumpy and generally unwell, feeling 10 minutes after eating. Diarrhea, I would use a diarrhea medicine, and I would use either Bovista or tuberculinum. That's the way I would look at it.
Is there a specific protocol for tree nut allergies?
Well, there are no specific protocols that I'm aware of for tree nut allergies. But if you were to crack open a repertory, you would find specific remedies, but not protocols. They would give you the names of remedies that are used for nut allergies, but they won't give you the potency and they won't give you the frequency.
And you would usually use Bovista first anyway, right?
That's right.
If somebody gets migraines from MSG, would calc carb uproot that?
Migraines from MSG, I would think more in terms of Nux vomica, because Nux vomica is for artificial food, and MSG is an artificial food. And then I would use a medicine that is specific to migraines, such as sepia 200 every 3 days, and picric acid 200 mixed with belladonna 3, specifically for migraines.
And would you consider Bovista or Pulsatilla?
No, I don't think that I would. I thought about that. You and I discussed it, but I don't know that I would think of that.
Okay, so should Bovista be included for assumed food intolerances?
Well, it depends on how much you assume it. You know what I mean? If you say, well, this must be food intolerances, I don't know that I would go with that. I would consider staying away from those foods and seeing how the person does it. If there's some improvement, it doesn't have to be grand improvement, but if you see a little improvement, then I would say, okay, there's some food intolerance here. Then in that case, I would go ahead and use it.
Okay, so does Bovista help with seasonal airborne type allergies?
Yes, it does. Yes, Bovista is great for allergies in general. It's not the only one, but yes, it is one of our best.
One of the side effects of a food reaction for me is a sore throat on one side and sinus congestion that never turns into a cold, but often does turn into a long-standing sinus infection. Is there a remedy for that?
Yes, we use Bovista as the baseline and then use a remedy specific for the sinuses, and you can find that on my blog. And we use both.
Bovista is the protocol for food intolerances, but you always say to pay attention to how the intolerances are presenting, such as bloating. But what if there are not any gastrodisturbances, rather autoimmune symptoms, such as all over muscle weakness, fatigue, vision changes, photosensitivity, blurred vision, brain fog, anxiety, difficulty breathing whenever eating certain foods?
Then in that case, we would use Bovista for the food intolerances and then go into the conditions that are presenting. So we're not going into vision changes so much. I would go into what is the bigger condition. So is it the difficulty breathing? That's pretty major. Anxiety can be pretty major. Brain fog is going to probably correct by just taking this on in general. But I also find that brain fog is often, and this is subsequent to my having originally taught this class, I find that LicoRs and often Athusa is great for brain fog. So remember those two, LicoRs for brain fog, especially if you can find bloating or gas. And if you can associate any of this with dairy intolerance, then I would go more towards Athusa, and that would touch the brain fog, the food intolerance, etc. So you might use 2 or 3 remedies here.
If somebody has allergies but doesn't have frequent colds, would you still use calc carb, or would you rather go with tuberculinum? And will Bovista help with allergies besides food?
That's not written, right? Oh, here it is.
Yes, that was
allergies but not frequent colds. Use calc carb still. Tuberculinum. I would go with Bovista unless you could find a real good rationale for using that calc carb and tuberculinum, which we've just discussed a few minutes ago.
This person writes, I know 2 babies, one is 5 months old and one is 6 weeks old. Both have abdominal pain, wriggling, moaning while taking formula, explosive diarrhea, thick liquid sludge, yellow-green, and both are not growing well. They have dry cheeks, flatulence. Veratrum album after each passing of stool did not help. Both of the mom's instincts were that milk caused. So would you consider Athusa, calc carb, Bovista, LicoRs? The older child tried lactose-free for 4 days, cried a lot with blood in the soft green poo. Are milk problems common in babies?
Yes, milk problems can be common in babies. Yes, absolutely. And if the diarrhea is thick liquid sludge, yellow-green, let's see, they're 5 months, and well, 6 weeks is a little bit difficult to go because at 6 weeks old, the stool is often a strange color and liquidy. But at 5 months, that's a lot different. Then I would use a remedy that's specific for diarrhea. And if there are flatulence, then I would consider LicoRs. That's certainly a good possibility. Veratrum album after each bowel movement helped.
No help.
Oh, no help. Oh, I see. Okay, no help. All right, so then we put that aside and go to something else. And we would use the LicoRs. We might use arsenicum alone. We might use Nux vomica. Depends on what kind of births were these? Were these highly medicated births? We might go with Nux vomica or pulsatilla or chamomilla. And I'm sorry to give you so many choices and for you to figure it out, but these it's a lot of information here. It's 2 babies. I'm not sure that we can go through all of them. But the bottom line is, yes, milk problems are common in babies.
For allergic reactions, is it also prudent to carry carbolic acidum?
You bet. You bet. Absolutely. Keep that on hand. 200.
If refined carbs cause joint pains and fats cause dry eyes and itchiness, do you have any suggested remedies?
Well, certainly it would be Bovista. And for the joint pains, we would use Roostox plus Symphytum. Remember, that's on my blog. You would look up arthritis or joint pains, and you add that in there. So it's Symphytum and Roostox mixed together. And for the eye condition, more often than not, it would be Euphrasia 30. And all of these would be twice a day, except for perhaps the Bovista might be every other day.
How do you know if you need to add a more general gut remedy, such as Bovista, to a case, instead of only using a specific one, such as Lyco-Rs for bloating?
Because if there's a food intolerance or an allergy, then I would automatically use Bovista. But if there's only bloating and it doesn't have anything to do with foods or allergies, then I would just stick with the Lyco-Rs.
How do you treat someone who doesn't have high blood sugar, but doesn't seem to properly digest carbs or sugars? This is after Halonius and Calc-Carb were both proved. There's a family and personal history of obesity and diabetes.
Doesn't have high blood sugar, but doesn't seem to properly digest carbs and sugars. What does that mean? Doesn't properly digest carbs and sugars? We're being too intellectual here. What happens? Oh, there's bloating. See, I'm just coming up with this. Oh, there's bloating. That's how you know they're not digesting carbs. How do you know they're not digesting carbs and sugars? What are the symptoms? We're not going to intellectualize as to what is going on. Instead, what we're going to use is what are the symptoms? If they have bloating, you're going to use the bloating protocol. If they have diarrhea, you're going to use the diarrhea protocol. That's the way this is looked at. You see, when you say doesn't seem to properly digest carbs and sugars, gives me no information. It's intellectualizing it. So use the remedies that are specific to how these conditions are presenting. Use the symptoms, and that will be that will be your schedule.
So for the remedy Syzygium, when do you use that one, Joette?
When there is clearly a blood sugar problem. Okay. Or if there's a strong craving for sugars, or if they're too strong a craving. I mean, all they want to do is eat it all day long, or they do eat it a little bit and they get sick from it. So it's anything to do with blood sugar.
All right, so here we have behavior and milestone questions. I haven't heard anything about oppositional defiant disorder, which is often part of the larger ADD, ADHD picture. What would you choose for a child who opposes authority, especially the mother, is very defiant, insists on doing things his way, making homeschooling different?
Difficult.
Difficult, yeah, sorry. So this is, covered in the mindful homeopathy course.
Yes. Yeah. I would urge you to, when something goes, and that's the way I try to teach these, is according to conditions. So we use good gut, bad gut. We have a course called mindful homeopathy, meaning it's all on behavior and emotions and the intellect, etc. If it's a feminine condition, then we use the feminine course called feminopathy, and then you can overlay one on top of the other. If there's a young girl who's going through menarche, for example, I'm going to switch gears a little bit so you get a slightly different picture. She's having difficulty with menarche. She's only getting her periods once a year or once every 6 months, and she has food intolerances. Then you would use something like pulsatilla, because pulsatilla is, and you learn about that in feminopathy, that pulsatilla 30 or sometimes 200 is great for problems with menarche. And it also happens to be a great remedy for food intolerances when the child craves ice cream and can't have it. So you see, what we're doing is we're going to try to put the whole picture together that way. I wish I could give it all to you all at once, but unfortunately, there's so much information to give. It's the only way that I can think to do this, and Laura helps me think this through as well, is to segregate these into classes, to separate courses. And many of the folks who take
you could just do one course that lasts 10 years.
Right. But many of my students take one course, so they often start with Gateway to Homeopathy, because that's learning with others, and I think that's an excellent thing to do. If you folks have not taken that, It's very inexpensive. It's an opportunity to meet like minds throughout the world. You actually meet on Zoom, or you can meet together in your living room or your church basement or something like that. That is a great way to get started in meeting others. And then there's a Facebook page in which everybody helps each other. So that's, I think, I can't remember, $50, $50, $60. And you could take that course or that class as many times as you want, and you only pay once. You can join many different groups from all over the world, but you only pay one time for the manuscript and to get involved. So I would urge you to consider doing that. And as I've said, many of the folks who've taken that Gateway 1, and then they follow it up with Gateway 2, and then they go to Good Gut, Bad Gut. That's often the way most people get started on this. But some flip it around. They start with Good Gut, Bad Gut first and go to others. But many take all the courses because they have lots of kids or lots of interest, lots of curiosity. They're practitioners who want to learn more. They're mothers who have children who need lots of help. They just take course after course. It's a great way to do this.
So for behavior, for stramonium, when you use stramonium for anger and rage and defiance and stuff, what potency and frequency do you usually like to use it, Joette?
I often use stramonium in a 6, but sometimes we use it in a 200.
And would stramonium be your first choice usually for defiance?
Well, stramonium certainly for anger. For defiance, I might use hyoscyamus as another possibility. And I often use hyoscyamus in a 6.
Okay. Twice a day?
Yes, both cases, twice a day. Or both remedies. Not both remedies together. When we choose one, we use it twice daily.
Yeah. If there is a known mold exposure problem and the symptoms include very wild behavior in kids, how would you treat this?
That's in the mindful course. I go into that. Look, sometimes we don't know what the cause is. What if you didn't know that it was mold? Would you be able to treat this? You bet. We would use the remedies that are specific, to the very wild behavior in kids. And then that would be either hyoscyamus, stramonium, it could be tuberculinum, and we cover that very thoroughly in the mindful course.
For the ADD protocol, is the protocol the same for both hyperactivity and the inattentive type?
Again, this is in the mindful course. Boy, we got a lot of questions that are for the mindful course, haven't we?
But you usually treat them both the same homeopathically, right?
Yes, we do. Thank you for bringing that up.
However, the whole symptom picture needs to be taken into account, you usually say.
That's right.
Okay, so for ADD, would it be Athusa and hyoscyamus or Athusa or hyoscyamus?
If there's a milk intolerance, if there are milestones that are behind, if there's a foggy brain, then I would certainly use Athusa. And I might start more with that. If instead there is none of that, and there's this particular behavior, this ADD, then I would go more towards the hyoscyamus. So I would try to use one or the other, not both. All righty.
So you said protocols are king, but if you haven't read the Materia Medica entries on those individual remedies, especially if you're unsure, you haven't completed your task. You need to know your medicines before you administer them.
And this is something that Laura and I discussed before tonight, and that's what I concluded, and I'm grateful for you reading it for me. Thanks.
If somebody has dyslexia, would you use hyoscyamus even without an ADHD component? And would Athusa be indicated due to the delayed reading and writing?
Yes, it would be. Athusa would be indicated due to delayed reading and writing because that's a milestone that's missed. It's being missed.
What?
Now, if using hyos even without ADHD for dyslexia, I don't think I would use. Off the top of my head, I wouldn't use hyos for dyslexia. I would use Athusa. And I would also consider tuberculinum. But again, that's also in the mindful course.
When you use Athusa 200 for delayed milestones, do you now most often use it every other day, twice a day, or every 3 days?
Oh, I've used it all three ways, and it depends on how severe it is and how sweeping the need for Athusa is. In other words, if we see delayed milestones and food intolerances and foggy brain, then I might use it twice daily, and especially if it's very severe. If it's kind of more in the background and it's just a little delayed milestones, it's not a big problem. There's not a lot of food intolerance. There's not a lot of dairy intolerance. Only if they eat an enormous amount, it causes trouble. Then I would be a little more conservative and use it every other day, or even as infrequently as every 3 days.
Our 27-month-old son seems delayed in his speech and is only saying a handful of words clearly, but shows no other missed milestones. Can Athusa 200 every other day be enough to progress speech on its own, or would we also need to seek speech therapy or other interventions?
A delay is a delay. Is it a missed milestone? Yes, it is. Then you would use Athusa. And would you need another therapy? I can't say that I would make a decision for you such as that, but I will say that you might want to use one or the other to determine which one is acting, and not use both simultaneously. If you decide you want to use speech therapy, use only speech therapy for a while and see if it works. If you want to use homeopathy, I would use only homeopathy and see if it acts. Because if you use both and there's improvement, do you stay with the homeopathy? Remember, this is medicine. You're not supposed to continue with it unless it's doing work. We won't know which one is doing the work. So I would use one or the other so you have a baseline. All righty.
Okay. Sometimes you call for stramonium twice a week and sometimes twice a day. How can I know which frequency is better for the individual?
Well, it's not unlike what I just discussed a little while ago. That is, the more fitting the need, or the more fitting the condition is to stramonium, the more extreme the condition is, then the more likely I'm going to use it more frequently. So it depends on severity.
And and you discussed how well the remedies fit the person.
Right.
You said make sure that the reason that you're changing or going to a higher frequency or potency is not because you're anxious, but because there's a good solid rationale.
Yes.
So what you see that when, for example, a mother is treating a member of her family, the potency and frequency she chooses should have nothing to do with her emotions and how anxious she is over the condition.
It's hard to parse that out, folks. I understand that because I'm a mother myself. I take care of my mother full time. She has late stage Alzheimer's, and she'll be 90 soon. And she is and I have full care of her. And when something goes wrong, and even as a mother, when I was treating my children, it was hard not to get involved in it and say, they must need this medicine every 5 minutes because look how bad it is. Oh my gosh, this is terrible. I'm so responsible. I need to do something. But you have to really fight that urge to do that, because otherwise you're going to be making a decision based on your need for ignatia or coffea rather than the person's need for the remedy. I also want to mention that I've had many people communicate with me indicating that when they take these courses, and especially this one, that they don't just go through it once. They come up with far too many questions when they take it only once. They go back and do it again and review the notes a third time. In fact, one person told me, I think she said she did it 5 times, and she missed a lot of information until she reviewed it a second time and a third time and a fourth time, and then her questions were answered. This is a lot of information, folks. And for those of you who have no background in homeopathy, it can be overwhelming. So I urge you to do that. Before you consider taking another course, learn this one inside and out. It doesn't cost you extra just to review it again and again and again. Make it your mission. If this is important in your life, make it a focus.
And just like Joette talked about earlier, use the free blog articles to supplement what you learned here, because Joette will describe things in a slightly different way, and it helps you to flesh stuff out. And there was a very important series that we use in homework in a lot of the other courses that was written after this Good Gut, Bad Gut course was originally done. It's called the What to Expect When Using Homeopathy series. I think that's a 3-part article series, and it goes through what Joette calls magic markers, or the different markers you want to look for to help you gauge how you're making progress when you take a case.
Yes, that's right.
All right, so questions about female ailments. What are menopause issues that warrant using ammonium carb?
Menopause. Just the fact that someone is going through menopause is
What if they're sailing through menopause with no problems?
Then the menopause would have to be thank you for asking it that way. If they're sailing through, then there's no pathology, we don't use a remedy. But if they're suffering through menopause, it is one of the main remedies we consider using regardless of what the symptoms are. Then we add the remedies specific to the symptoms. So if now they've got hot flashes, yeah, then they would use perhaps sulfur or laxative. If they're getting headaches, then they might use sepia, but ammonium carbonicum is often our baseline. So I see that often, and the same thing with some of these other medicines we've been talking about, using Bovista for food intolerances, especially wheat and etc., gluten. I see it like a symphony. And let's use this ammonium carbonicum. Ammonium carbonicum is the string section. It's what the string section carries the melody and a good amount of the harmony, and it carries the entire symphony. But every once in a while, the person gets a migraine, and so that's the glockenspiel that comes in. Or they might have hot flashes here and there, so that's maybe the triangle that comes in. So what you want to do is keep the main remedy, ammonium carbonicum 200, as your mainstay, and that's always carrying the condition. Meanwhile, we use remedies that are specific to other conditions that come up from time to time, or even not time to time. But ammonium carbonicum is our baseline.
When you talk about inherited taint, can a homeopathic protocol be used preventatively in a prepubescent girl, for example, to help prevent severe bleeding issues from arising that her mother and grandmother both had, or would you just wait and treat if and when it arises?
We wait and treat until it arises. It doesn't mean that we can't use remedies for this young girl now for conditions that are presenting, because that can help perhaps her travel through the menarche stage. But I would not use, I would never use a medicine for a little girl or child who doesn't have a condition.
For someone who suffers from low estrogen and progesterone, which seems to be caused by food sensitivities and nutritional deficiencies, what remedies would you give in addition to those for the food allergies? This is really more of a feminopathy question.
Yes, it is a feminopathy. Yeah, go ahead.
My guess is that you would say that you would need to know how that's presenting, what the symptoms of low
estrogen and progesterone tells us almost nothing. Does this mean that she has hyperpigmentation on her face? Does this mean that she has hot flashes? Does this mean she has vaginal pain? Does this mean, infertility? It doesn't tell me much of anything. It tells me what a naturopath would tell me. We want to know what is the name of the condition that she's got, that a conventional OBGYN would discover. Not discover, would declare.
Yeah, so a conventional OBGYN for low progesterone might say luteal phase defect, for example. So that lets us know that her cycles are too short.
Right. So if the cycles are too short, that means that there's something, that's something that we might, it depends on how short they are. If they're just, a little differential of a few days, that's one thing. But if they're super short, then we would use something specific for that. And that, again, is in the feminopathy course.
For dysmenorrhea in girls, you said ipecac and mercurius for vomiting. Is that mercurius sol or mercurius sulf?
I would use merc sol. Or in the interchangeable, which is Merc-Vive.
If a girl has cramps and vomiting, but it's only on the first day of her period every month, would you use pulsatilla for weeks?
I would use something that is specific. If you could justify the use of pulsatilla throughout the whole 28 days, such as she's craves ice cream, or she can't have ice cream because it makes her sick, or she's weepy, read pulsatilla and make sure that it fits. Then it would justify my use of using pulsatilla frequently. Otherwise, I might use the remedy only. If it doesn't fit, then I might use the remedy only in the case, only at the time of need.
For women's libido, if the response to sepia 200 twice a week is minimal, should the frequency of dose be increased, or is there a second line?
If the response is minimal, if there's a response, I would stay with it. I would not encourage someone to hop off of a remedy that's acting. If it's minimal, it means it's acting. Give it more time. Don't be impatient.
What if it's not working at all? Would you
not working at all, then I would move on. Yes, then I would move on.
Or would you just try a different remedy?
Yeah, I would go to the second line. Absolutely.
But they're asking what if there is a second line. What would you suggest as a second line?
I don't know I don't know that we gave a second line for low libido in feminopathy. If there is a second line, then it would be in that course. But to be honest, I don't think there is a second line.
Yeah, you never really
Yeah, I don't think we have a specific second line. For low libido, then I would look at if sepia is not helping at all, then I would look at any other condition that's going on that is particularly hormonal. In other words, is the menses off? Are there headaches? Seem to be related to menstruation? And then choose a remedy that would incorporate those.
And then find out, try and find out if it's really a physical pathology. Maybe somebody's just mad at their husband. Maybe, there's other things going on. Sometimes it's physiological and sometimes maybe it's not. So that would help to know as well.
Yep.
Okay. One of the ways people can test for something like that is if there's a physical response to other people or, or other things like, if the woman shows strong libido and maybe she has a crush on a movie star, that it would show that there's probably not a physiological problem.
Yep. Good point.
Okay, so sepia versus ammonium carb during menopause. When would you use one and when the other?
I'm hesitating because that's such a broad answer to this question. It might seem as though it's an easy question for you, but to be honest, I think that you want to read both, but as I said earlier, during menopause, if it's ammonium carbonicum is our baseline, sepia if there are specific conditions such as headaches, weightiness of the uterus, etc. Again, this is found in feminopathy, but that's a kind of a good short answer that I can give you to at least spike your curiosity in reading more.
Both feminopathy and mindful homeopathy talk a lot about sepia and give lots of different characteristics that you would look for. But you can also just buy Joette's Materia Medica.
Yeah, just get to the Materia Medica and read it. Absolutely.
There's free online Materia Medicas too, but I like Joette's because of the way it's worded. It's worded just like Joette's blogs. It's very easy to understand. For heavy menstruation, would you use China?
I would use China for heavy menstruation for the loss of fluids, but I would use other remedies that are more specific to menstruation, blood loss from menstruation. So I would use both, China and other remedies. And it depends on how it's presenting, if there are cramps along with it, or if there's clotting, etc. And again, that's all in feminopathy.
Would you use China for heavy menstruation for loss of fluid if the person is drinking a lot and not dehydrated?
It's still a loss. It's still a loss.
Okay.
Yep.
Let's go to the next slide.
Okay.
Antidoting, proving, and aggravation questions. How far back would it antidote if you smell something unplanned and unavoidable, such as essential oils that somebody is diffusing or your child eats a candy cane, for
Oh,
example?
all it does is it stops the action of the medicine at the moment. As soon as you take the medicine that night, it starts you right up again. It's not going to undo, it's just going to stop the action. It's not going to undo all the good that you've accumulated.
I proved calc carb 200 every 3 days and started getting numb-like arthritic fingers, so I stopped. If you prove, can one try a lower potency? I think this is the same person we read earlier about the numbness.
Yes. Okay. So
kind of answered it earlier.
Yeah, let's go forward.
When using the Banerjee protocol for fibromyalgia twice a day, I get severe intensifying of the exact symptoms it's meant to be helping with after 3 consecutive days of use. I found if I cut back to administering twice per week, this doesn't happen. Is this the right thing to do? And in a few months, should I try to increase to 3 days per week?
Well, if you find that you cut back to only twice per week and it's acting, then it is the right thing to do. If instead you found that by cutting back to twice per week and you see no improvement, then it's not. So we want to see the medicine acting. And you can always try, if it's acting and you're pleased with it, using it twice per week, then you can always try to increase it. But I don't know that I would tinker with success. I would stay where it works.
So I think a lot of students are unclear about, whether or not they're proving a remedy. If they're taking a remedy or protocol and then some new symptoms arise. And I think if the symptoms are found in the materia medica for that remedy, it's more likely to be approving than if the symptoms aren't something that's found in the materia medica for that remedy, right?
That's absolutely right.
And then would it make sense if you think you're proving a remedy to stop for a while and then try again and see if it happens again?
Yes.
Later?
Yeah, it might be. Yes, it might be worth it if it's trying enough and you need to move along. Yes.
Okay, questions about diet. Is juicing or would smoothies be best for gastrointestinal healing?
Homeopathy is best for gastrointestinal healing. I mean, I'm not going to tell you that I don't think that diet matters, because I do think that food matters. But if you want to heal, you need a good medicine. So
plus, I think when you've been in this, field of work for a long time, you hear so many stories where one person juicing made them better, another person juicing made them worse. One person can only eat white bread, another person can only eat whole grain bread. One person does better on pasteurized dairy, another person can only do raw dairy. So for every rule, there seems to be an opposite, right?
Right. So it's difficult to come up with the answer unless you kind of tried it. Some people do well on GAPS diet, others do very poorly on it. For many people, bone stock is very gentle and mild, and eating vegetables in their bone stock is great. For others, bone stock is like poison to them. So I would move as quickly as possible to get to the right homeopathic medicines. And then you won't even have to worry about exactly which foods are needed for healing, because this medicine, when chosen correctly, if you've got the right diagnosis and you've got the right remedy, I think you'll be astounded at the kind of effect that it will have in healing the gut.
Why don't you recommend fermented cod liver oil anymore?
I believe it's a mistake to take fermented cod liver oil, because Dr. Weston Price never talked about fermented cod liver oil. He talked about fermented vegetables, fermented grains, fermented dairy, fermented meat, but he never talked about fermented cod liver oil. I didn't come to it through that, though. I came to it through my family. We took fermented cod liver oil religiously for years. I bought it by the case. And every time, I never used capsules, or I didn't use capsules in the beginning to save money. So when we used to take it, I could taste it as it went down my throat, because I could taste burning in my throat. And for me, the response of burning in the throat always meant rancidity. If I eat a walnut that's slightly rancid, I get burning in my throat. And that's so for many people. So that was my first clue that something was wrong. And the second clue was that it tasted ferment, or tasted like it was,
Rancid.
yes, like it was rancid. And so every time I tasted it, and we did it every night, all 5 of us, and actually 7 of us because we included the dog and the cat, I had this response. And so I would say, okay, the bottle must be bad. And we did this for years. That's how strongly the human brain believes something when they read it and just can't believe that this stuff could be bad. I think it is not good. I think it is very dangerous. Now, cod liver oil on its own is probably fine, as long as it's not rancid.
One thing I thought was very interesting actually going and reading Nutrition and Physical Degeneration by Weston Price, is one of the reasons he was so excited about the X factor, as he called it, the butter.
Yes.
Is because the combination of that high vitamin butter and the cod liver oil allowed him to use less cod liver oil. Weston Price was anxious to use as little cod liver oil as he could get away with, because he knew that it did have some toxic properties. And he believed it could cause, damage to the heart, among other things. So Weston Price himself felt that cod liver oil had therapeutic potential, but he wanted to limit how much he was using for people.
So it had to be mitigated. Yes, I agree with that. And then Dr. Kayla Daniel came up with research, and I had already stopped using cod liver oil. I had a whole case or half a case of it in my pantry that my family and I had not touched for a few years, when Dr. Kayla Daniel came out with her research. And I think that she did fine research. And Dr. Ron also did some research, and I believe that that they hit it right on the nose. I don't believe in cod liver oil, and I used to believe in taking cod liver oil daily. I think that cod liver oil in small amounts when someone is ill, or if they're not getting enough sun at all and they live in the coldest climate ever, and they take it judiciously and just a little bit here and there, it can be useful. But I would follow Dr. Weston Price's method, and not others who believe that fermented or cod liver oil used daily in abundance is a good plan.
This ties into some really fascinating discussions that we've had about your path from being somebody who used a lot of supplements to somebody who uses very few supplements nowadays.
I use no supplements. Yes, you're absolutely right.
And there's a lot of really interesting information that we've been researching recently in terms of certain supplements and how they can do damage, especially when taken in large doses. And we're hoping to include some of that in the next course that we're planning. That's going to be coming up in the beginning of next year, probably.
Yeah, it's going to be on toxicity, which is a very fascinating subject. It's important to again, I'll harken back to what we were discussing earlier about the supplement business. And it's not as though I consider them the enemy, but they have led us to believe that we live in a very toxic world. That there are planes flying over us dropping toxins, that I haven't heard the word acid rain in an awfully long time, but that was a hotbed of discussion years back. That our farms are lacking in nutrients because of all of the toxic farming methods, and that we're doomed. And I used to believe that some few decades ago. I no longer think that way, and I'll tell you a couple of reasons why. I don't believe the food that I buy is poor food, is low in nutrients, because I buy from organic farmers. Now, I don't always get it directly from the farmer, as I used to. When my children were growing, I would go directly to the farmer. And they would rotate their crops, and they used manure, and they used intelligent practices. And I believe that the nutrients were there and still are there. I bought a lot from Amish who've never changed their ways, never used pesticides. Some of them have, but many of them don't. And I trusted that those nutrients were indeed in the soil because it's the way it's been used with them for hundreds of years. Now, if I were to be eating conventional, fast foods daily, then I would be worried about my nutrients. but be careful that what's being spoken to, speaking to the lowest common denominator doesn't include you, folks. You are not the lowest common denominator. You make your foods. I know that because I talk to many of you and I know who you are. I don't know you necessarily personally, but you wouldn't be taking this course if you were drinking diet soda and giving it to your kids and giving them sugary, desserty type breakfast with skim milk, etc., as a daily fare on a regular basis. Look, I don't expect you to eat perfectly. No one can eat perfectly. And I expect that you should be able to eat at McDonald's. I want everyone to be able to eat at McDonald's. And I expect that but what you're really doing is that you're probably making most of your meals at home. I think that is grand. And the second reason that I've changed my thinking, which just really solidified it, because I had already been thinking this way for some time before I went to India. And when I see the kind of reactions that folks have in India to these homeopathic medicines, in spite of many of them who have very poor diets because of grinding poverty, I see that even they too, who have such severe poverty, can get past many conditions by using this good medicine. So I could talk about this subject forever. My husband's pointing to his watch. We've got 4 slides left, and we really should be moving along.
Okay, so I'm going to read these last 2 questions on this slide together. Is there a time when adjusting one's diet should be done along with homeopathy to help with digestive issues? And what is the balance of diet and remedies for improving gut issues?
Well, I think I just covered it. I feel pretty confident that I've covered it.
Yeah, pretty much. Okay.
Yeah. Okay, good. Let's go to the next one. That's slide 22. Okay, yep. Go ahead.
Questions about books and resources. For Dr. Ortega's miasm book, it's out of print. Do you have any other suggestions on books about miasms?
Yeah, I have not moved my complete library back to this new home, and there are other miasmatic books, but to be honest, I don't have any recommendations at this time, so I apologize for that, other than Dr. Ortega's.
Is there an index by symptom or by keynotes for typically used remedies? Please suggest references for beginners.
Well, you can always.
You might have heard.
Go ahead.
You might have heard the word repertory mentioned in this webinar tonight.
Or in other aspects of what I teach. There's a repertory. There are repertories, and they are very in depth. And the one that I choose that I like best is Dr. Robin Murphy's repertory. It's expensive. It's, I don't know, a few $100s, I think, the last time I looked. I have a Materia Medica, and that's very inexpensive, and I will tout mine because I believe that mine is easy to understand, and it's specifically geared towards the thinking of using protocols instead of using classical homeopathy.
Now, I know that there's online free Materia Medicas. Would there be an online free repertory? I could think of maybe ABC Homeopathy.
Yeah, I would say ABC Homeopathy. And I bet there are others. I've just never investigated very thoroughly.
But ABC Homeopathy is the website. It's spelled just like it sounds. And they have what they call a symptom finder, and you can type in the symptoms, and the more symptoms you type in, the more refined the answers will get, but it'll give you the top remedies for those symptoms, which is basically what a repertory does.
Right. I find it, and I think you will agree, I find it quite confusing because it asks, and just the way repertory is confusing to someone who's new. You really have to be clear on how to input your information, just as you would in a repertory.
Yep. And sometimes it can kind of help you if you're not sure how to input it. If you put really vague terms, it'll offer suggestions that you can then choose. So that might be a better way of doing it. And somebody asked, have you considered formulating a protocol book? I have the Banerjee book, but would like as many protocols as I can get.
Yes, I don't blame you. Yeah. Well, that's what these courses are about, because I try to give as much information as I can on my blog for simple conditions in which there's a simple protocol, and I love giving those out. But when it's more complex, such as gut conditions, feminine conditions, skin conditions, then it requires more involvement in explaining it. And that's also probably a good part and parcel why the Banerjee book does not include obviously they can't include every condition. There are thousands of them. So, and it would look like, in the end, it would look like a repertory, or close to a repertory. So we don't, it's pretty in-depth. So we try to give it the courses.
Yeah, if you did have a book, it would look very similar to the courses because you feel that all that explanation is necessary in terms of learning how to use the remedies. So it wouldn't be much different than taking the course. And with the course, you get a lot that you wouldn't just get in a book. So. All right, all the rest of the questions. Do you have specific tests that you like to use to get a diagnosis? For example, tests for parasites?
Yeah, I like conventional medical diagnostics. Getting it from a conventional doctor. I think their tests are the most concurrent with these protocols.
When using homeopathy for first aid, is it more classical in its approach or more protocol-based in its approach? You said earlier that it's definitely more protocol. You wouldn't sit down.
Yeah, it's more protocol. The classical homeopaths are using protocols for first aid. So no, you would not use. You might use some classical, but for the most part, I use Banerjee protocols and practical protocols for everything. I very rarely use classical.
What if symptoms at first improve but then get worse? For example, if using Lyco-Rs for gastro complaints and it initially gets better but then gets worse again?
Then it's time to move on. You go to the next medicine.
This is a good, go read the What to Expect When Using Homeopathy series for some good tips on how to measure progress.
Exactly.
Can diabetics take remedies without affecting their sugar levels? I have a relative who believes that they will.
Oh yeah, it could affect their sugar levels if they're taking a good number of them and they're in the lactose or sucrose. So instead, order your remedies through OHM and water or alcohol.
Can remedies be traced in the blood, say if you have a drug test at work?
Not like a drug could be traced, as far as I know. There's no test that shows that so far.
Human suffering can be and is unbearable at times. Thank you for your knowledge and sharing. Now that you are well, may I ask you if you follow a homeopathic maintenance regime on a daily basis to keep you feeling well?
No, I really don't. I don't take any homeopathic medicines unless there's something wrong. Sometimes I take some herbs once in a while to thicken my hair, that kind of thing. But I barely even take those anymore now. So no, I don't take anything. I eat well and pray the rosary and get outside and walk. I live close to the beach, so I go for a walk on the beach.
When using homeopathy for a chronic condition, is it best to reassess in 8 weeks, 13 weeks, or 2 months?
Well, I think we answered this earlier. It's anywhere between 8 and 13 weeks.
Okay. In the skin class, you've mentioned that perorial dermatitis is related to gut health. And in Good Gut, Bad Gut, you've given many examples of remedies for food allergies. But if the person shows no sign of allergies or ill health other than perorial dermatitis, what then?
Then it is only skin condition. You're absolutely right. And they should not be looking at the gut to uproot this. Instead, you use remedies that are specific to the condition that's presenting and just drop the idea of the gut.
Are autoimmune disorders considered immunity issues that would warrant the use of calc carb?
No. I mean, no. There could be a situation in which that would work, but that is not what we're talking about with immunity issues. What I've mentioned in immunity issues has more to do with catching colds, getting fevers frequently, getting eye infections, ear infections, etc.
Can adults be colicky?
Yes, they can, absolutely. And it's usually cholesynthis, by the way, for colic.
This person wants to know what are symptoms of colic, but it's best if you just go to Google and look up what are symptoms of colic. Yeah. It's generally not the right forum to ask for a description of a disease. Joette would be more focused in telling you how, in her experience, to homeopathically treat the disease. But for finding out what are the symptoms of a disease, the internet's probably your best bet, or a good medical book. For those diagnosed with celiac, would the remedies for food intolerances actually allow someone to eat gluten again, or just heal the damage done from eating gluten?
Well, the goal would be to be able to eat gluten again, but probably not in great abundance. It would have to be slow, a little here, once in a great while, um, and um, and it would depend on their wellness in general. You know, if they're doing really well and they're starting to eat a little gluten, maybe a little piece of bread once every 10 days, and then they break their ankle, or they have to have surgery, and now they've had antibiotics, then it's likely what's going to come back is more of that gluten intolerance, but perhaps not to the same degree as it had been previously. So it's what you're looking for is relatively good health, not perfect good health.
For vaccinosis, if someone was vaccinated as a child and had health issues ever since, can Thuya still be used, or would you recommend other protocols based on the current subset of symptoms, or would you do both?
I would use the current subset of symptoms. I would not use Thuya just because someone was vaccinated. And
this person wrote.
Go ahead.
Yeah. This person wrote, do some protocols darken your hair? And I'm not sure if they're asking for protocols that could reverse hair graying, or if they're asking if...
Well, it's interesting. Lycopodium can darken hair. Yes, it can darken the hair. It's fascinating. A lot of times hair that's been too gray, that grays too early is one of the keynotes for Lycopodium. I would not use it for that reason necessarily, but because I love my gray hair. But I would, I've seen a change. I've seen hair color change. I've seen red hair turn darker brown. Yes, I've seen that happen.
Now that's really interesting to me, because my husband is one of those people whose hair started graying at a very young age, and he definitely would have other Lycopodium signs going on. So that's really interesting when you almost see, confirmation of a remedy in different areas of a person's life.
Yeah, and more often than not, people who need Lycopodium and have gray hair, the gray hair is often in a shock in one area, a little streak, a little patch in the front, or it's all in the front and not so much in the back. Lycopodium was a great remedy for me, and I got all gray here, and then the back of my hair and underneath was all dark. And that does happen that way for a lot of folks, but when it's very stark, it can be another keynote for an indication for the use of Lycopodium.
In class 4, you covered a case where Rhus tox was used 1 week on and 1 week off. Why was it not used continually?
This was a case, I think, of the 36-year-old female. She submitted that she was already taking Rhus tox 1 week on and 1 week off, and had been much improved as a result of it. So I stuck with what she was already doing because it was working. And I do that frequently. If someone tells me I'm taking this remedy, this is the way I've been doing it, it's working, then by all means I stay with it.
When was Good Gut, Bad Gut recorded?
It's either the end of 13 or the beginning of 14.
Yeah, I wasn't sure. Perry might remember better, but the question just came in recently and I didn't have a lot of time to look it up.
Yep.
I've been on Synthroid for 25 years. Is it worth taking the thyroid remedies at this point, or is it better to treat the symptoms I'm experiencing?
I'm not sure how I know how to answer that. I need more information. I'm sorry, I can't answer that without knowing what these symptoms are that are being either talking. Is she talking about thyroid symptoms that she's experiencing? I'm afraid I can't answer that.
I used Bromium 6 twice a day for 6 months for thyroid without Lycopodium, but had zero change in symptoms, which are hair loss, very cold, dry skin, low libido. Will Sepia 200 every 3 days be a better choice?
It might be. It might, it depends on if you have other sepia conditions going on. So read sepia, and if it seems to fit, then we're moving in the right direction, then certainly it could be. Or you could go back to Bromium with Lycopodium.
How would you choose a remedy
also, let me also mention that 6 months for thyroid is just about the time when most people start seeing a change. Thyroid's a little bit different. It takes a long time for the thyroid to react. So that's why when I say between 8 and 13 weeks, there is a range, and it depends on the conditions. Thyroid happens to be one of those outlying situations in which it really takes a long time. So does psoriasis. Can take a very long time. It can take 2-3 years to see some real movement. So 6 months might be just around the time that you might have seen a movement. I would consider continuing, adding, and also adding lycopodium.
How do you choose a remedy for someone who is presenting eczema only in the winter with no other allergies present? I thought eczema was supposed to be an allergy, usually to food. Is taking the eczema protocol going to attack the root of the problem?
Well, I pronounce it eczema is covered in the skin course. And so that's a rather in-depth question that is very fully covered in that course. I'm sorry to be so vague about that, but.
So it's not necessarily an allergy. It's not necessarily food.
It's not necessarily food intolerance. It's not necessarily an allergy. It often is, but not always.
But for eczema that presents in the winter, you would go ahead and start with the eczema protocol covered in Good Gut, Bad Gut, right?
Yes, that's right.
You would assume it would attack the root of the problem.
Yes.
And you've also mentioned, I think, petroleum for skin that cracks in the winter, right?
Yes, and petroleum is also for eczema in the winter. So yeah, petroleum would be the remedy that I would certainly consider, plus others if there's other aspects of this, like itching it through the night, or if there are pustules, if they ooze yellow, etc.
All right, next slide.
All righty.
I think.
Wow, we're done. Knowledge will bring you the opportunity to make a difference.
Over 3 hours.
Yeah, it's a long one.
We'll just got 3 hours because we.
Yeah. You know, I like this statement, this quote, but I don't think it's just knowledge. I'm going to be honest, folks. I think it has more to do with action. There are a lot of people who have a lot of knowledge and do nothing about it. You have to move forward. And sometimes we don't have all the knowledge. Yes.
Can I say something about that? So I'm
Yes,
sorry we didn't get to the live questions that came in because there were, I think over 200 questions that were sent in ahead of time. But knowledge and action, you can do action by going to the student forum and discussing the questions that you typed in live tonight with your fellow students.
Yes.
And you will learn a lot.
You will learn a lot. There are a lot of folks in these classes that are quite knowledgeable. So take advantage of each other's information. Get to know each other. It's really a blast. It's like a pajama party without, setting each other's hair. I guess I'm showing my age.
So, sorry to interrupt you, Joette. Do you remember what you were saying?
Yeah, I was just saying that, knowledge is lovely, but it's not about knowledge as much as it is about action and doing something about it. And sometimes we don't have full knowledge. Sometimes we just have a little knowledge. I don't think a little knowledge is a horrible thing with action. That's how we learn. So let us know what you thought of tonight. We want to know. We would like to do more of these kinds of meetings for folks so that we can get this information to as many people as possible and get you your knowledge, get your needle moving on the knowledge that you accumulate. So here's I hope I've ignited your passion tonight, folks. And I've got my torch right here. And so I'm going to virtually pass it on to you and have you all pass it on to everyone else that you know. Treat as many people, neighbors, friends, relatives, church mates, old school buddies, if you're going to have your reunion coming up. Help others and pass this knowledge on to them. And with that, I wish you a very happy Hanukkah and a beautiful Merry Christmas, and God bless all of you. And so with that, good night, folks. Take care. Bye now.
Bye, Joette.
Bye, Laura. Good job.